We actually get into the real rulemaking process. So at this point, just like any of our rules, we would schedule public hearing. We would file the rule with the Secretary of State and start a public comment on the rule. So we would still be taking feedback from stakeholders and others at that point in the process as well. After the public hearing, it would go back to the commission to ask them to approve an order of rulemaking, and at that point we could file the rule with the Joint Committee of Administrative Rules. And so one of the requirements at that point is that we have to file it with the Joint Committee by December 1st of that year. And the reason for that is the following year, the legislature has the ability to review the fee structure that we came up with. And within the first 60 days of the session, they could take action to either approve that fee structure or to disapprove that fee structure. And so if they did, that would require us to revert back to the fee structure we currently have in place. If not, then that would allow that fee proposal to move forward, and it wouldn't be able to go in effect until January 1st of the following year. So it lays out a pretty long rulemaking process, and so it takes us a long time to get these fee rules in place. So we have to start early in the process to try to get that fee in place by the time that we'll need it. So in this slide, I just want to kind of lay out, kind of the general timeline for the rulemaking effort. So we're looking from January to April to work with you guys on trying to build what the proposal should look like. And then in July, we will need to take that proposal to the commission. So we're targeting July 8th for the first meeting to present to them the concept, and then July 10th to have the second meeting for them to vote to approve that. And then we would look to file the rule, and we would schedule a public hearing probably sometime in the September timeframe to review the proposal, and then we would be looking in the November timeframe to go to the commission and ask them to adopt the final order of rulemaking. And then that would put us on schedule to get that to JCAR by December 1, and then to hopefully have a fee that could be in effect by January 1 of 2022. So that's kind of the timeline we're looking at, and as we talk, you'll see why it's important that we try to get it done on that quick a schedule when we start talking about some of the financial issues. So that's just kind of a quick summary of the process and the fee stakeholder effort. Does anybody have any questions or anything before we move on to the next topic? All right. So a lot of these first part of the presentation are going to be background type things, just to try to make sure that everyone is kind of aware of some of the things that we're doing, what the current fees are, and our activities and the level of effort that go into those. So this first part, we're just going to run through the current fee structure that is in place and explain what fees the department currently does have on the books right now. So this first slide is, first fee we'll talk about is the primacy fee. And so obviously this is the major fee that we receive that helps support the program's activities. That fee was set in statute in '92 and revised again in 2006. And it provides approximately $5 million in revenue to fund the department's activities for drinking water. The way this fee works is, it's paid annually by customers based on the number of connections the water system has. The water system collects those fees for us as a pass-through fee and then submits those to the department. So it's really a fee on the customers of those systems. The water systems are allowed to collect 2% of those collections as part of their effort, for collecting those fees for us. And then you can see on the right what the current fee structure for there is. It's a tiered structure. So for smaller systems, from 1 connection to 1,000 connections, it's a higher fee. It's $3.24. And then it tiers down as the systems get larger and have more connections. And the larger systems pay $1.08 per connection, or the large customers of those systems pay $1.08 per connection. And then there's another tier for larger meter sizes. So when you get up into the meter sizes that are greater than an inch, there's a higher fee that's associated with those. As far as collections of that fee, we've been doing really well. We have less than 1% of systems that, we have to work with to try to remit those fees. I think the number is probably actually closer to 0.5%. So, we have about 99.5% compliance with collecting that fee. So
David,
the next fee is...
David, can I ask a question, please?
Yeah.
Over here.
Oh, hey, Robert.
Where did the word primacy come from? How does it get that name, primacy fees?
Okay. So primacy is basically what allows the department to be the implementer of the Safe Drinking Water Act in Missouri rather than EPA. So by having primacy, that means we're the implementer of the Safe Drinking Water Act in Missouri. And so the primacy fee was set up to help support primacy activities. So our main functions, like doing inspections and monitoring and those kind of things. And so that's where the name came from. It's basically allowing us to have the support we need to implement the program here in Missouri.
Dave, is primacy a term of art in the Safe Drinking Water Act?
I assume, it's essentially that is the term that all state agencies that implement the Safe Drinking Water Act use. You are called the primacy agency if you are the one who's doing the primary implementation of the rule. So if a state like, I think it's Montana, who doesn't have their own program, EPA is the primacy agency in that state. But in the other states, it may be the Department of Natural Resources, like for us. Other states may have their Department of Health and Senior Services be the primacy agency. So it is a term that's used in there, and it just defines who is the responsible entity for implementing that program.
So your next slide, lab services and program administrative fees, these are not required for us to operate the program because it doesn't have a title primacy fee on it. Is that correct?
These are required because we have a statutory requirement in our state rules that require us to provide laboratory services for all public water systems. So this is a fee that the statute requires in order to help fund the cost of providing laboratory service.
Okay, thank you.
But EPA does not require us to provide laboratory service. So to meet the federal primacy, we would not need to have that fee, if that helps answer that. Okay, so just a little background on what the lab services fee does cover. The fee was established again in 1992 at the same time as the primacy fee, and it was revised in 2006. It provides approximately $251,000 in funding per year, and it's paid annually by public water systems, except for municipally owned and water districts who were not able to charge this fee because when we initially put this fee in place, there was a legal challenge to it, and based on the Hancock Amendment, we were not allowed to charge that fee to those specific water systems. So this fee is basically being paid by our transient systems and private water systems. Again, collections of that fee have been going pretty well. We have less than 1% of systems right now who we have to work with to try to get that fee collected. So overall, pretty good metric there. As far as the structure, transient systems currently pay $100 for that fee, and then other water systems with more than 4,100 service connections that use groundwater have a $200 fee, and larger groundwater systems, more than 7,600, have a $300 fee, and then those with more pay $500. And then also surface water systems also have a $500 fee. So the next couple slides are actually some fees that aren't set in statute but are part of our fee collections, and these are set by the commission in our regulations. So the first one is a lab certification fee. So this fee was originally initiated in 1992, and it provides about $22,500 a year in funding. And so labs that get certified by the department have to pay this fee. Currently, this applies to those who do chemical laboratory analysis, or those who want to be Certified for organic chemical analysis, that fee is $2,700. Those who want to be certified for inorganic analysis pay a fee of $1,500. And then there's a laboratory audit fee of $2,500 that we charge when we go on site to review those audits. All of those are 3-year fees, so those aren't annual. Those are once every 3 years that they would pay. And there's about 13 labs, I think, that are doing that. And then on the BACT side, we have 67 labs. They currently do not pay a fee. So there is no fee currently associated with our bacteriological labs certification process.
Do you certify the bacteria labs?
We do.
Free of charge?
Free of charge. So the last fee is the laboratory services and program administration fee. Or I think I went backwards here. It's actually our operator certification fees. So those fees were established in 1991. They were revised again in 2001. And they provide approximately $100,000 a year to support the program's activities. So there are 4 primary fees there. The application fee for when they want to take an exam is currently a $45 fee. If they want to retake the exam, it's a lesser fee, it's $20. We have a 3-year renewal certificate that is currently $45. And then a reciprocity certification that's $65, and then late charges that can range between $10 and $20 for those. So that is the current fee structure associated with operator certification. So those are the 4 primary fees. Are there any other questions kind of related to those before we move on to the next part of the presentation? All right. So
I got a question.
yeah, go ahead, Robert.
Sorry I asked so many questions. I got to understand this stuff.
And that's fine. That's why we're here.
You said that due to the Hancock Amendment, some cities aren't required to pay that lab fee.
The lab services fee, correct.
So does DNR just provide free services to them for that?
Well, the primacy fee is covering a lot of those costs. So we use the primacy fee to pay for laboratory services. We'll have a slide later that shows you what the actual cost of providing some of the laboratory services is, and you'll see that that fee doesn't come anywhere close to paying it. It's paid probably about 10% of what it costs to provide laboratory services. So the primacy fee was set up to also fund those activities. So that is one of the reasons why that fee was set up, to help pay for the cost of providing those lab services, in addition to helping to pay for the cost of staff to run the program.
So the primacy fee is not really a primacy fee then?
There are uses of the primacy fee for things to implement the state requirements. So that it isn't just to implement a straight federal program. It is actually to implement the requirements of the state's safe drinking water law. So the way the statute is written, we can use those fees to do any of the activities associated with the safe drinking water law in Missouri. So to implement those statutes. And one of the things it specifically addresses is providing this laboratory service as well. So I think this fee got set up because the way the primacy fee works is it's only applied to community water systems. And so the lab services fee was set up to try to capture some of the other water systems that don't pay the primacy fee, so that they're providing some funding into the situation. So the lab services fee was never really set up to cover all the cost, because there are caps in it right now as to how much you can charge, and so it can't cover the cost the way it's set up. But I think it was set up, like I said, to help subsidize and make sure that those payers had to pay into the process to get that service.
I know this is a dumb question, but so why do those folks don't need to pay the primacy fees? Some that are paying the lab fees. Why don't they pay it? Because they have connections, right?
Because it's a connection fee, All right, so if you're talking about a water system like a restaurant or a gas station, they don't have customers. They're a business. And so you have transient systems like that, or a state park, or something like that. And so they don't have connections. So the community systems are the ones who have those connections. And, I wasn't around when the fee was set up, but I assume that was the intent, was to have customers of the community water systems pay. And so when you get these other kind of systems that don't have customers, this is the fee that structure got set up for them to pay in.
So on your operating expenditure sheet, make sure your mic's on, please, Charlie. Everybody hear me now?
Yep.
All right. So on your operating expenditure sheet, you show revenues, but I didn't see that lab fee revenue, so different ones you went through.
So you're looking at the FY19 operating expenditures. Okay. So this is really expenses and not revenues on this chart. So this is kind of a breakdown of, where we have FTE in the program doing activities and where we have pass-through cost and things like that for lab services. So, we do have like the cost of our health lab and things like that to try to tie into that. But we will have information in the presentation to kind of show you the fees and things like that. You might be able to see some of that better on this chart. It has like fee revenues. It's not broken down by specific revenue type, but it is broken down by total fee revenue and other non-fee revenue with the federal. And so I think we'll have a lot more discussion on that when we get to later parts of the slide where we kind of talk about the different streams of revenue that we have that come into the program. So we will get to a lot of that.
It might just be nice to have a sheet if you had a revenue sheet so we could track where the different revenue pieces are coming from. So, just a suggestion.
Yeah, and I think we'll see a little bit of that in the presentation. We have a slide that will show you by fiscal year the different fee revenues that come in and how much they make. So I think we'll get to a slide that has what you're wanting to see. Dave?
Can you just real briefly tell me the justification or the thinking, because this is a pass-through to the user or the connection, so why the small system user fees are so much higher than the large system users? Because it's being directed at that user, and just why that fee is so much higher.
So I wasn't around when those were put in place, but I think the idea is that when you look at the number of customers, so when you look at those larger systems, they have a lower rate set because they're paying a lot more. That water system, so the largest ones may be paying $250,000 into the system to help fund for the sampling. And then when you look at the smaller systems that may only have 10, 15 connections, they may only be putting $45 into the system, to pay for the lab services. And so then if they pay the lab service fee on top of that, they have a lower fee there, so they're paying like $200. So when you look at a small system like that, they may have a $200 lab services fee, they may have a $45 primacy fee. They're only putting $245 in, and we'll show when we look at the sampling numbers that that's not covering the cost of even providing service to them. So I think that's why they came up with that structure. But that's something we can talk about too, whether that makes sense going forward or not when we get to that part.
I think just like organizationally, like as we get to the slides that correspond to the handouts, we'll like say, okay, now we're going to talk about the numbers. This initial part of the presentation is to try to give kind of the background piece, and so we'll get there. Trust us, we'll get there. We've poured over this, Dave and I and others, to try to make sure that this flows in a way that everybody understands it. So, I just maybe in hindsight we should have handed stuff out as we went, but you know what I mean. So no black boxes, Charlie. We're definitely going to get to all the money and all the pots of money and that sort of thing. So
And some of these will get, the handouts will get discussed as we go through the slides. There's
Right.
a few areas where it'll tie into what we're talking about at the time. But Karen, go
This,
ahead.
yeah, this may be jumping the gun too, but I was curious on the difference of the meter size, what the logic was for the larger meter size paying the larger amount.
Yeah, I'm assuming the logic there that if you have a larger meter size, you're probably using a lot of water. You know, you're looking at, a business that's pretty water intensive, or you're looking at, maybe a apartment building or a condo that needs to supply a lot of water to a lot of customers. And so the fee, I guess, is derived to just bring in some additional revenue from those larger systems that are bigger users of public drinking water. All right. So are we good with the current fee structure? All right. We'll move on to the next part, which is drinking water activities. We just want to make sure that everybody has a good understanding of the program, how we're structured, and the activities that we do. So the next part, we're just giving a lot of background of the things that we do here in the department and kind of the number of staff we have devoted to different activities. So this slide will kind of give you the organizational structure for the department. So I work in the public drinking water branch. You can see us down there that we have about 40 FTE that do work to implement the Safe Drinking Water Act. We're in the water protection program, so Chris is our director. We have about 4 additional FTE that work in the water protection program doing our admin and other things, and Chris, who provides support for the branch. You can see the Financial Assistance Center, which is also within the water protection program. They have another 7.75 FTE, and they're the folks who run our SRF program and work to provide low interest loans to water systems. And so you'll also see that the predominant amount of FTE we have is in our regional offices. So we have 45 FTE in the regions. Those are the folks who do all the field activities, and they're probably the folks that you see most of the time because they're the ones who come out to your facilities, do the sanitary surveys, respond when there are concerns, and that type of thing. And then we have 13.75 FTE that work in our environmental services program. So they're the folks who do our chemical monitoring. They're also the folks who do our chemical lab certification program. And all of us reside within the Division of Environmental Quality. There are 2 other divisions, Division of Administrative Support and Missouri Geological Survey. You see we have some directly funded staff in the Geological Survey. And those are folks that help us with public wells. So they're reviewing, well casing points and those types of things. They're also doing vulnerability assessments on those wells, which allows us to reduce the amount of monitoring that we have to do. So we have a work plan with them and we'll talk a little bit more about all of these in a little more detail later. This is just kind of give you an idea of where they're at in the program. And then outside of the department, we have the Missouri Attorney General's Office. We currently fund 0.2 FTE there. They work as the commission's legal staff, and they also help us out whenever we have cases that need to be litigated. And then we don't fund any staff at the Missouri Department of Health and Senior Services currently, but we do fund the activities that they do with the health lab to sample for bacteriological issues.
Dave, and we also should probably touch on the AGO FTE
Okay.
set to increase in 2021.
Yeah, the small print down there is that we did recently kind of evaluate the AGO funding at the department to make sure that programs were paying in appropriately for the representation they were having over there. So it was determined our 0.2 FTE was a little light for the amount of cases that we have over there and the support they're providing. So that's going to be increasing to 0.59 FTE, so a little over a half a FTE in FY21. But that helped balance out some other programs in the department that were probably overfunding their share of AGO support. So that was an effort we underwent. And this one, just give you a better idea of the branch itself, since we're the primary administrators of a lot of these activities. So we're broken down into 4 sections. We have the monitoring section, which is our largest section. As the name implies, they're the ones reviewing all the sample results, verifying compliance with those. We have our compliance and enforcement section. It actually has 2 units within it, but that consumes our enforcement staff as well as our capacity development staff. And then our permit section, we have 8 FTE currently associated with reviewing permits and those activities. And then in operator certification, we have 6 FTE there. Now, in operator cert, they do also do some wastewater activities and CAFO activities, so they're about 70% funded on drinking water, 30% on those other activities. And we're going to go into a slide basically for each of those areas just to kind of get you a little more background on what they do. And so you can see some of the metrics that are kind of associated with the work they do and the level of effort that's involved there. So the monitoring section, they're responsible for monitoring approximately 4,000 entry points at over 2,700 public water systems. So they're reviewing those, trying to determine compliance, identifying when there are concerns. They also put folks on alternate monitoring schedules when those are necessary. So when we get hits of certain contaminants, we may have to move folks off of standard monitoring to a more aggressive monitoring or quarterly or something like that. They're the ones who are reviewing that data, making those decisions to make sure that we're complying with the Safe Drinking Water Act. They also manage a lot of our data. So they manage our SIDWIS, which is our state drinking water information system, and all of the thousands of records that we have in there, water sample analysis, size of systems, the connections, all the information that we have about water systems is in that database. And they're the group that primarily provides the support for that. They also create and host our consumer confidence reports that get put out on the website for water systems to use, and maintain our drinking water web page so that the public can see what those samples are. And then they coordinate our laboratory certification program with the Department of Health and Senior Services, as well as with our environmental services program. So we have to issue all the certificates from the central office, but those 2 groups are the ones who are actually out there doing the reviews and making the certifications. So just some of their statistics. They reviewed more than 87,000 samples last year. So it's a large volume of samples that we do every year. They have to review all of those to determine compliance and to ensure that we're complying with the Safe Drinking Water Act. And then I just threw in here some of the statistics on water systems so you could see how many there are. For community water systems, we currently have 1,429 in the state. For non-transient, non-communities, we have 218. And then for transient non-community water systems, we have almost 1,100. So a little over 2,700 water systems in total. So a lot of systems that we have to monitor, track, inspect, all those kind of things, just to kind of give you an idea of some of the workload associated with that. Next section is our compliance and enforcement section, and like I was saying, they're broken down into 2 units. They have the compliance and enforcement unit, and they have the capacity development and source water protection unit. So our compliance and enforcement, they issue notices of violations, and they are the case managers that work with facilities when they are out of compliance, try to get them back in compliance. So they will be negotiating agreements and settlements and those kind of things, issuing orders when they become necessary. So that's kind of their core function. And then we have the capacity development and source water protection unit, which is our group that tries to implement the source, basically implement our capacity development program and try to improve technical, managerial, and financial capacity of public water systems. One thing I'll mention about that group is we have to have a capacity development and source water protection program in place, or it would cost us a 20% hit on our capacity development grant that we get from our EPA, our capitalization grant that we get from EPA each year. So there are two programs, this one and operator certification, that are both required for the state to have if you want to get the full allotment of that capitalization grant. That grant's about $20 million, so when you take a 20% hit off that, it's a $4 million reduction off of that grant. And that's what goes in to fund our state revolving fund loan program, and also set-aside grants that we use. So that is an important program, as well as operator certification, to make sure we're getting the full amount of funding that we get from EPA. But that group also does a lot of work with our technical assistance providers, trying to make sure we're getting resources out to small water systems, whether it's training, whether it's on-site visits, those types of things, try to build those capacity of those small systems. They also do our source water protection work and implement our contract with CARES. So you can see some of the statistics there. FY19, we had over 1,500 public notices associated with violations. We had over 174 compliance assistance visits associated with our training providers that we've coordinated with. We coordinated 17 training for our public water systems, and we have about 90 source water protection plans in place, and we endorsed 35 of those last year. And then we have an abandoned well plugging grant program that group implements. We had about 7 grants last year for, I think, around $60,000 in funding. The next group is our permit engineering section. So as the name implies, they're reviewing all of our permits. We have 2 types: construction permits and permits to dispense. And I think everyone's aware of that, but just so you know, you didn't hear me talk about permit fees, that's because there are none. So these activities are essentially paid for with primacy fee activities, money. And I think some general revenue is how we use it in the program to fund engineering work. But in addition to reviewing permits, they also oversee their backflow prevention program and our area-wide optimization program that tries to go out and provide more detailed compliance assistance at water systems. They also, when we have systems that are struggling and need to have a comprehensive performance evaluation, they're the staff who would be leading that effort. They also are responsible for reviewing corrosion control evaluations associated with the systems that are required to provide that under the lead and copper rule. And they currently oversee our engineering report services grant program, but that's another thing that we'll talk a little bit more about as we're kind of looking at a change there. But some of their metrics, you can see that we have about 1,250 certified backflow operators in the state. Again, that's another area where we have kind of a free service. We're not currently charging a fee related to certification issued to backflow certificates. They handle about 436 construction permits and 115 permits to dispense last year. So we do a fairly large volume of permits for the 5 engineers that we have back there. And they issue emergency waivers and grant awards for our engineering grants. We issued 16 of those last year. So the next group is our operator certification section. So they're the group that's responsible for making sure that we have trained and experienced operators running our systems. To accomplish that, they develop certification exams to make sure that our operators are competent. They determine eligibility based on their experience reviews and those kind of things. They issue and renew the certificates, so those certificates are good for a 3-year period, so they're constantly reviewing certificates every year that are coming due. They do the approval of the training courses, so for training providers that are out there providing service, they look at those training and determine how much credit those get for the continuing education credits that the operators need to have. And then they publish a water and wastewater digest every quarter to get information out to operators on new things that are going on and keep them updated on department activities and regulations and those kind of things. And And then we have a voucher program that they implement. And we'll talk more about that program later, but it's an assistance program to small water systems to help them with the cost of their training fees and operator certification fees. And just so you can see kind of the level of effort they have, drinking water certificates, they did 5,800 of those last year. So it's a large volume of work. And then also you can see the numbers for wastewater and CAFO certificates. Drinking water is by far makes up the most, and so that's why that group is funded primarily out of drinking water. And also with operator certification, the conditions to the grant apply to drinking water, not to the wastewater activity. So the wastewater is a little bit more optional by the state, but the drinking water is pretty much a requirement for us to have that program, or we would lose a significant amount of funding. And so last year they reviewed over almost 1,000 exams and approved over 1,000 courses. So pretty large volume of work for that group also. So the next group is our regional offices, and so this is the group that does all of our field work and goes out and does inspections, complaint investigations, and that kind of work. They also do construction inspections, so they go out and review newly permitted activities. Construction gets completed, they go out and review that work and make sure it was done appropriately. They also perform a lot of compliance assistance visits, so they go out and try to assist systems around the state when they have issues and need assistance. And they conduct operator training out of those offices. So we have 5 regional offices, and then we also have an inspection group, that works out of our Jefferson City offices. So we have offices in Kansas City, Macon, St. Louis, Springfield, and Poplar Bluff. And then we have a central field operations group that operates out of our Jefferson City office here. And so a pretty large volume of work. As far as sanitary surveys, we're required to do a sanitary survey once every 3 years for community water systems. And then for our transients and non-community systems, we're once every 5 years. So to accomplish that, we do about 800 sanitary surveys a year. So it's a pretty significant effort to get that many surveys done. We also do additional inspections that may be, more targeted. They did about 317 of those last year, and SRF inspections, 35. Compliance assistance visits, you can see they did about 143 of those last year. And then training sessions, each region has a water specialist that provides training. We did 173 training sessions last year. And they proctored 49 exam sessions as well. And then there's a lot of investigation work. So a lot of times when we see an unsafe sample, we'll ask the regions to go out and investigate that, whether it's bacteriological or we see something of chemical nature in the water. We'll ask the regions to go out and investigate that, potentially take additional samples. So we had over 712 of those last year. And then they're the group that's responsible primarily for issuing boil orders and things like that to systems when those are necessary. So pretty large volume of work that gets handled by our regions, which is why they're had the most FTE that you saw in the grouping a while ago. So the next group's our Financial Assistance Center. And so their main function is to implement the state drinking water revolving loan fund. So they work to provide low interest loans and in some cases grants to public water systems to help with infrastructure improvements. They develop the annual intended use plan that says how we're going to use the funds related to our capitalization grant. That includes including our set-aside programs that we'll talk about more that we can use to help with technical assistance and activities for public water systems. And then they do a lot of marketing to try to go out and promote the program. So last year, you can see their expenditures, a little over $50 million in expenditures related to loans and grants. They received 13 loan applications last year, and then they've gone out and did some road shows, and they had 5 workshops last year, had 160 people attend those to try to get out and promote that program. Next group is our Missouri Geological Survey, and so as I mentioned earlier, they're the group that helps us with a lot of the public well issues that we work with. So there's two groups that we partially fund. The Water Resource Center has a group that works on public well construction assistance, so they're looking at setting casing points for wells, reviewing the cuttings from those, and analyzing pump test data. And providing technical assistance to well drillers and others related to that. One of the big things they do for us is our vulnerability assessment. So they annually review all of our public wells, and you can see last year that was about 2,600 that they look at to make sure that those systems aren't vulnerable to organic compounds and those kind of things. And so when we have them do that, what that allows us to do is we can issue waivers for monitoring for things like synthetic organic compounds and that kind of thing. And that saves us quite a bit of money. So it's a good investment for us. I think we save a little over $1 million a year in sampling costs by having them do a vulnerability assessment. They also maintain a lot of GIS data for us that we use in source water protection and in doing these vulnerability assessments. They also review our groundwater under the influence. So if we have a well that we suspect is under the influence of surface water, that group will be involved in reviewing that data and helping us to come to that conclusion, whether it is under the influence or whether it's not. And then we have the well installation section that we fund a part of a FTE there, and that group is the one who certifies all wells in the state. And so the part we fund is to fund the certification of public wells. So that group, normally I would say they have about 30 or so wells each year that they're working on. Last year it looks like was a little low. I think they had 24 wells that they did casing points on for us. We generally have a GUI determination, or groundwater under the influence determination, going on at some point that we have them working on, and then the vulnerability assessment and maintaining our GIS information is a pretty large task as well. And then I think this is the last group, Environmental Services Program. So this is the group that does our chemical monitoring for us. So all the BAC-T monitoring goes to Department of Health and Senior Services. All of our chemical monitoring goes to our Environmental Services Program, with the exception of radionuclides, which we send down to the St. Louis Health Lab. So they're involved in mailing out the kits and sending out those kits to water system. They maintain our laboratory information system with all the records of all that data. And then, again, they're the ones who perform the certifications for all of our chemical lab certifications. You can see kind of the numbers of lab samples that went through the lab last year, about $13,500 or 1,000 samples went through them, and there's kind of a breakdown of the different types there, so you can kind of see the volume of work that goes through the lab. So that was the quick review of the program and a lot of the activities that we do. I'll let you guys ask any questions if there's anything you have questions about. And I'll take a drink. All right. So seeing none, we can go on to the next section. And what we're going to talk about here is some of the services that we provide. So we talked about some of the core functions and things on the last slide. This will get into some of the additional services that we provide to public water systems. So the primary one is our laboratory services. So we talked already a number of times about that. We have our two labs that are providing laboratory services for public water systems for the 91 chemicals and microbiological contaminants that we monitor for under the Safe Drinking Water Act. A lot of work goes into that. They're the ones who are determining the schedules for water systems. They're sending out the kits. They're sending out chain of custody forms. They're doing a lot of that work up front. They're covering the shipping costs and things returned with that. We have a courier service, that could be used to return samples back. and all of those things are things that if you went to other states, you probably wouldn't get as service. I think there's only 7 states that I think in the country that provide services like this, where they do full analytical work for all the public water systems. In a lot of states, the water systems would have to be doing all of the scheduling. They would have to determine when they're going to collect their samples. They would have to arrange with a lab to get those kits sent to them. They would have to pay for all those shipping. So it really is a big service that we provide. And this was what I think the folks, when they initiated the primacy fee, wanted. They wanted this service provided, and that's why they were willing to work with us to have that primacy fee in place. So this will kind of give you an idea of the cost associated with that. So our chemical monitoring costs us about $1.4 million a year to implement. Our bacteriological sampling currently costs us about $480,000. And then like I mentioned, we send our radionuclides to a contract lab, St. Louis Public Health Lab. That costs us about $280,000 a year. And then we have other monitoring that we're required to do that we generally contract out. That can be the unregulated contaminant monitoring rule that we have to implement on once about every 5 years. They come out with a new regime there that they want us to sample for. And then the long-term too, enhanced surface water treatment rule, we contracted that lab out as well for all of that sampling. And that cost us on average about $100,000 a year to do that additional monitoring. So you can see that the cost of that service is about $2.2 million a year. And as I mentioned earlier, our lab services fee really only covers about $251,000 of that a year. So that's $2 million that is getting covered out of the primacy fee. And so I have one handout that's kind of associated with this that you might want to look at. It's the one that says state analytical laboratory cost to provide services. And so we put this together to kind of show you what the cost is for the different types of water systems. So we've got a cost breakdown in the first column on this chart that kind of shows the cost of the health lab, the cost of each of the different types of contaminants that we sample for. You can see what it cost us to do that. And then you can see what we project it cost for each of these different types of systems. So a transient non-community system, we project cost about $171 a year for us to do the sampling for. And if you look below in the chart, you can see how we estimated that. So for a transient, we're looking at 12 samples per year for bacteriological and 1 nitrate sample. So based on the numbers up there for the average cost, that's how we came up with the numbers for that. So you can see what they're required to test for and what they're not required to test for up at the top. And so for groundwater systems, our average cost is about $1,400 for those systems. And then for a surface water system, our cost gets up to about $3,000 a year to provide those services. And then if you flip that page over on the back, we did a kind of a comparison so you can see what the cost of going to an outside lab would be versus the cost of using the state service. And so you can see in that first column, it's the average commercial lab cost. And so we did some calling around, got some, bids from folks, find out what it cost them if we would go to a lab to have that service. And so that was the average of that cost. And then these are the numbers of what we project our cost. And so you can kind of see on this chart then when we project in the number of samples that we did last year, what those costs would be. So if you went to a commercial lab, the average cost would be almost $2.5 million for the same level of service that we're providing for $1.9 million worth of service. So you can see about a $600,000 savings there in cost. And you can see some of the footnotes on here. One, we didn't include the synthetic organic compounds because when we got the bids, we didn't really include the waiver process. So we felt like the bid that we got here from the labs is probably high. because if we would have included that in, you would see a huge value for the state service. But part of that is because we know what we're not sampling for and what we're waiving under that, and so our cost is lower. And I don't think we were able to get the cost with the waivered contaminants from the labs in time.
So Dave, just to elaborate on that a little bit more, the branch negotiates with EPA waivers of sampling on behalf of the program because we run the program. If it wasn't in place, systems wouldn't have that opportunity in most instances.
Yeah, so the way it works is there's a 9-year compliance cycle, and so every 9 years we have to put together a plan for how we're going to sample during that monitoring period, and there are waivers that are allowed, and so we can within the rules where we can show that their systems are not going to be vulnerable to those activities, and so by going through that vulnerability assessment process and identifying those systems that are vulnerable, we can put together a waiver or a monitoring and waiver plan that we send to EPA for that 9-year period. And if they approve that, then we will be able to move forward with waivers for certain contaminants. There are some contaminants that we have to do some sampling for. So like asbestos is one you'll see later that we have to do a one-time monitoring for some asbestos over that 9-year cycle, but then once we've identified that the vulnerable systems aren't having an issue, then we can waive that for the rest of the monitoring period. So pesticides are a lot of the ones that we're able to get these vulnerability assessments. If we can show that those pesticides have not been used or not available, then we can reduce our monitoring for those kind of things. Another point I want to make on this chart that is in one of the footnotes is that our cost also includes shipping, whereas the cost we got for the other labs does not. So when you have certain samples that require 24-hour time frames to get there, you're looking at additional shipping charges of like $15 to $30 to get your sample to a lab. So our numbers cover the cost of that. These lab numbers would not cover the cost of that. So again, that would make this a lot more beneficial service. We just weren't able to calculate how many kits, how many samples to give you a better number of what that cost is, but relatively for each sampling event that you're sending samples in, you could save $15 to $30 in shipping costs. So we feel like that program has a lot of value to it, and it's a service that's very beneficial to public water systems. Another service that we provide is our consumer confidence reports. The department hosts those on our website. Essentially, we build the consumer confidence report, put it on our website. That allows water systems then to put a link to that report on your bill, send it to your customers, and that meets the requirement for you to provide a consumer confidence report to your customers. Last year, 569 community water systems, totaling more than 757,000 connections, took us up on that and used that service. And so the benefits, no direct mailing to your customers other than sending the bill that you're already sending. No publishing costs because you're not having to print the report, and no staff time to put those reports into your envelopes and mail them out to your customers. So we project that that would cost at least 70 cents per report, and so I think we're at about a $530,000 savings to water systems by providing that service. Okay, this next slide shows some of our federally funded activities that we do, and this is what we use, our set-asides that are part of our capitalization grant to fund a lot of these activities. So I'll do just kind of a quick run through of what these are. Our engineering report services grant, we provide about, and these are FY19 numbers, so last year we provided $325,000 to small systems to have an engineering report grant developed. That helps them make improvements at their system. It also is the first step in trying to move towards getting a loan or funding from one of the funding agencies. So it's pretty popular program. We usually have more people apply for it than we have money to award each year. We have our operator certification voucher program. We last year funded $282,000 worth of vouchers. Again, that's for small systems. They can utilize this funding to pay for their operator certification fees or to pay for the cost of training and that type of thing. We have our circuit rider program. Last year we contracted that out with Missouri Rural Water Association. It's about a $230,000 contract. And they do a lot of good work going out to systems, providing on-site technical assistance, providing training. They can provide training related to technical or managerial or financial type situations. So they help a lot with what water rates should be, help with how a board should operate, a lot of different activities. And then probably the most popular activity is their leak detection. They will go out and find leaks for water systems, and that program alone probably more than pays for the contract. I don't remember what the number is, but it's usually multiples over that $230,000 that we save each year in lost water rates and cost associated with leaks. So it's a really popular program with a lot of our public water systems. We've also funded university projects. So last year we funded Missouri S&T as well as the University of Missouri. And both of those were to go out and fund DBP studies at water systems. So disinfection byproducts is one of the most common violations that we have with some of our systems. And so they will go out and they did targeted sampling, trying to identify where the DBPs are forming in the system and provide a report to the water system that they can then use to try to make improvements to the system. We also had well plugging grants last year, about $60,000 worth, and that's a valuable program in that it allows to plug abandoned wells so that those wells are not a conduit that could lead to contamination in the water source. Last year we had a little bit of source water protection grants. That's probably actually more carryover from the previous year because we kind of halted that program, but we did have $37,000 in grants in funding that went out for those grants last year. And then we have our Center for Applied Research Environmental Systems CARES contract. That was $30,000 at FY19, but that's because we were doing some enhancements to that system. And so water systems or interested people can go out to that website. They can look at their water system, see the source water protection area, see the kind of things that are around that facility that could be a potential contaminant source. And so it helps systems build their source water protection area and plans and how to protect those areas. But that contract should only be $8,000 going out in future years when we're just doing maintenance as opposed to enhancement. So those are all federally funded programs that we use our capacity development for. These are more discretionary. They're not required by anything, but they do make up the core of a lot of our technical, managerial, and financial and our capacity development activities that we're currently doing in the program. So does anybody have any questions about any of those services before we go on to the next part?
Dave, I want to clarify something, make sure I understand.
Sure.
Back to the last slide. So you said these are all, they're discretionary in terms of how we build and fund the program, but we do have to have a capacity development
We do have to
program
have a capacity
in order to
development.
get the grant. So discretionary means we have flexibility, but we don't
Right.
have the discretion not to have.
Correct.
Okay.
Yeah, I mean, we have to have a capacity development program. We don't have to fund it through contracts. You know, we could use our staff. We could go out and do things to do compliance of system visits. You know, we've always used this to provide that extra level of support and assistance to small communities.
And it also brings in the ability to spend that 20% on the capitalization grant that's for having a cap development program.
Yes, if we didn't have a capacity development program, we wouldn't be able to pull in the full allotment. it would cost us 20% off of that grant. Like I said, it's a $20 million grant this year. That would be about a $4 million loss in funding if we didn't have a capacity development program that EPA would endorse as being a sufficient program. And so that's a lot of cost, and that would come back and affect how much set-aside dollars we have. So if we lose the $4 million in funding, the 31% that we divert to set-asides would also decrease. So it compounds the issue of funding if we don't get that full allotment.
Could you explain which grant is that again?
The capitalization grant.
But this money is coming out of the capitalization grant?
This money is coming out of the set-asides.
Right.
So the 31% set-asides, as part of this capitalization grant, we utilize the full 31% of the set-asides that are available to us. And so that money gets set aside, and we can use that to fund staff and activities and programs such as these.
But did I understand you to say that EPA requires you to use that money for the set-asides, or you can't have that money?
No, that's not what I was saying.
Okay.
So EPA requires to have a capitalization or to have a capacity development program.
Right.
And if we don't have a capacity development program, the Safe Drinking Water Act says that we will get a 20% reduction in what that capitalization grant would be.
Okay. Thank you for clarifying.
Is there any other questions related to that part, or are we ready to move over to talk about some cost savings? All right. So before we get into, talk about the funding situation, we want to talk about some of the things that we've been doing a little bit to tighten our belts over the last couple of years. I mean, we have been, for the last 3 years, looking at reducing some of our costs. So as far as personal service, this chart kind of lays out some of the reductions that we've been implementing over the last few years. So I talked about our Missouri Geological Survey and that work plan that we have with them to do those activities. And in that work plan over the last few years, we have whittled down the amount of FTE that we are funding with drinking water funds. So we've reduced one full-time position and one 1,000-hour position that was doing work related to that work plan. And we did that by basically streamlining the work activities that we were asking them to do. In our water protection program and fiscal management section, we've reduced 1.5 FTE reduction. And that was accomplished through moving a lot of workload that was in the program and consolidating that down in our Division of Administrative Support. That was kind of an effort taken by the department to kind of centralize more activities in that division. And so we were able to reduce 1.5 FTE of drinking water funding staff related to that. In the public drinking water branch, we've taken several reductions in our staff. We've had 3 FTE reduced over that period. One was a full-time position with a research analyst that's been vacant for a while. So that position we officially taken off of our chart. And we've had 4 1,000-hour positions. In the past, we had several of our retired staff who are really good technical workers and support staff who were assisting us with special projects and that kind of thing. Due to the funding situation, we tightened up our belt and we had to move on without that additional support. We also have 1.7 FTE that's currently on hold in the program. So we have one full-time position, which is an office support assistant, and we had 2 interns that we were initially planning to fill this summer that we decided we would put on hold and not move forward with. And then in our regional offices and our environmental services program, they had a half a FTE for a 1,000-hour position in one of our regions that was eliminated a year or 2 ago. And then we had another half a FTE that they were looking at for interns this summer that they have put on hold as well. So you can kind of see the total there, 6.5 FTE that we've reduced, 2.2 FTE that are currently on hold for For the interns, those are essentially reduced if they're not going to be funded this year. The OSA, we'll evaluate as we see if we are able to do anything with that position. But a point I'll make later is that we were able to reduce those services, and by other efficiencies that we made, it really wasn't an impact to services we're providing to public water systems. So we reduced the level of effort that we were having to provide by making some other efficiencies, and I'll talk about that here in a little bit. So some additional cost savings. These are kind of on the monitoring side and how we've reduced some cost. I think most of you are familiar with our red tape reduction efforts that we went through last year. One of the things that we did was we reduced the frequency of fluoride monitoring. So it went from monthly monitoring to quarterly. And we estimate that was about a $36,000 savings that we'll see every year in our cost. The courier service is another big area where we try to reduce costs. So essentially, Department of Health and Senior Services has a courier service. The more systems that we can get utilizing that service as opposed to having to use GPS call tags is a big savings for us. We can see that's almost a $13 savings per sample kit when we can get people onto that courier service. So we've been trying to be more aggressive about trying to get systems to utilize the courier because it will be a big savings for us, for those that move over. Under the unregulated contaminant monitoring rule, we looked very closely at where we were going to require samples this year, evaluated well data, and trying to find where we could find representative samples to take from well fields that would represent that entire aquifer. And by doing that, we were able to reduce the cost of sampling associated with that effort. We saved about $67,000 over that 2-year contract related to that. And then the vulnerability assessment, we've talked about that a little bit already. Basically, that's the assessment that MGS does for us that allows us to issue those waivers for synthetic organic chemicals. And we estimate that the cost savings there is almost a little over $1 million every year by the reduced volume of samples that we have to collect and analyze. This next slide is going to show you kind of the spending reductions and the set-aside. So we just talked about a few slides ago some of those services that we've been providing. And so we've been taking a close look at those, and over the last few years, we've been reducing the level of service on a lot of those things. So to really understand this a little bit, I need to explain a little bit why in FY16 these numbers are a little higher. So we had the situation where in FY16, EPA was really pushing hard for states to work through the unliquidated obligations of old grants. So we had a lot of past grant money that was sitting, and EPA was saying, hey, states, you need to spend this money or we're not going to give you a new grant, or we're going to pull back the money that we gave you, because EPA was seeing the issue where they make the capitalization grants, this money was sitting, it wasn't moving as quickly as they would like it, and so really they directed that we couldn't have more than 2 years of a grant open at any time. And so that really required us to amp up some spending back in that time period. So you'll see higher numbers in that FY16 years for a lot of these programs. But then as we move across there and we get into some of these years further where we work through spending those unliquidated obligations, we now had to back off of that spending and get back into more in line with the funding that we have available within a 1-year grant cycle. And so just so you can see for comparison here, like the University of Missouri, we initially started funding them to do special projects, doing some sampling and those kind of activities for us. They do a lot of occurrence research and that kind of thing to identify if we're seeing compounds out that aren't basically kind of doing an unregulated contaminant monitoring rule for our own purposes, going out and identifying things like PFAS or pharmaceuticals or those kind of things. And so over the years, we've had them do different types of projects. But we slowly scaled them down to, in FY19, to about $75,000. But then going forward this year, FY20 is the current year, we didn't renew a contract or put a new contract in place this year. So we're backing off of the funding for our university projects. Same with the University of Missouri. We've always kind of funded them to do DBP studies for us. And so we've done a lot over the years of DBP studies, but we've started to where we've kind of been to most of the systems that have problems, and so we didn't renew that contract again this year either. Board and council training was something that we were providing for a while. We had a contract with Missouri Rural Water who was going out and providing that level of assistance. And we did that for several years, but then in FY19, we stopped funding that program as well. Source water protection grants, talked a little bit about that earlier. We funded grants in several years. FY19 was the last year that we funded any of those grant activities. And then engineering report services grants, that's always been one of our larger areas where we've tried to provide assistance. In FY16 through 18, I think that program actually was a little more than it is now. Back then, we did phase 1 and phase 2 engineering grants. So phase 1, we would help them with an engineering report. Phase 2, we would help fund the cost of developing the design of the project. So that's why you'll see some larger totals in those first couple of years also. It's because we were doing more activities associated with that. But we've kind of weaned that program down last couple of years to where we're providing about $300,000 a year to provide those services. And you can note in FY21 that we noticed that we're transferring that to our financial assistance center. So we've been looking at that program. We currently fund it out of our set-aside grants like we've been talking about. But in FY21, we're contemplating making a switch to where we're going to fund those out of the state revolving fund grants that they have available. That is something that we will have to take to our commission to get approved. So we'll have to revise that in the intended use plan. We'll have to take that to the commission and get their approval to do that. But in the interim, that has kind of put a hold on this program. So we're not, normally this is the time of the year where folks would be sending in those grant requests, and we'd be taking those until April 1st. But we're actually going to be putting a hold on that, and it's going to be more in the fall after we get a chance to see if the commission will approve this activity, more likely in October. And if they do, we would be looking to fund this later this year out of a different grant source. And why that's important is that would free up $300,000 that we can then use to fund other things like staff activities and things like that. And FAC is obligated so much each year to spend so much of their grant allotment in their program. So this would be $300 spent out of their current grant allotment. They currently use those fundings a little differently to help fund projects, but this would be something that is within their purview to do, provided the commission approves them to do that. So that's kind of the plan with engineering report grants. And then the last one is our GEC contract, and that's our contractor who helps us with our safe drinking water information system support. So back in FY16, we had them do a number of enhancements for that, which is why you can see that's a little higher cost. The $70,000 cost is more typical of what we're currently paying for that service. But in FY19, we transferred that cost from paying out of this grant to our cost allocation to ITSD. So essentially that freed up some additional money there that we can then use to fund other activities, such as staffing and those kind of things. On the efficiency side, this is where I had talked about earlier. We had made some of those staffing reductions. These are some of the activities that we were able to do that helped us to absorb those cuts without really affecting the services that we provide. So the auto dialer, is one of the things that we've seen really be kind of effective in this last year. We use that to make phone calls and things out to water systems, do reminders and that kind of thing. Could be things like paying fees or get your monitoring in, those kind of phone calls. And what that does, it frees up staff time that we would normally have making phone calls. You know, consumer confidence reports was another area we used it to remind systems of the deadlines to get their certifications in. And so that saves our staff from having to make a personal phone call, and it gets a reminder out to those. So we save a little bit there, but the real savings is we get less violations because that reminder helps systems get the information in that we're requesting, which means our staff don't have to write violation notices for failing to meet those requirements. And then those things don't progress to enforcement and take staff time to go through that process. So that's been a real efficiency that helps us a lot in that regard. The next two are just kind of more streamlining things that we do. We have an online point of contact inventory form that we put on the web that allows our internal and external folks who know of changes that need to be made in SIDWIST for like contacts and things like that to send that information to us, and then it funnels it through our staff in an efficient way so that we're not having a lot of back and forth people trying to get information updated in SIDWIST. So that's helped a little bit in that function. Our lead and copper sample mailing improvements. We used to have a pretty cumbersome process of having to print labels and staple those to letters and sending it in envelopes. We found a way to where we can print that in a more efficient way, take some of that manual labor out of the process of stuffing those envelopes. And so that has saved us some support time in that regard. Again, red tape reduction. We did some things in our construction permit rule to help us reduce the number of permits by adding in some additional exemptions. So that frees up some of our engineering time from having to do more mundane or routine type things that don't really need a lot of review. So those exemptions will help our time of being able to issue permits and those kind of things. And we're also doing a lien review right now of our permit dispensing construction authorization process, trying to glean where we can make any more efficiencies. And that group is really doing pretty well. I mean, we, at this point, don't have anything that we consider to be a backlog of permit. And we've been knocking out permits on average in less than 30 days, which has been our goal. So we've been really doing some good work in getting our time frames turned around in permits. Some of the financial things that we've done, the bill pay and the procurement duties have been transferred down to a Division of Administrative Support. So that allowed us to freed up some time and allowed us to reduce those FTEs in our fiscal management section. Operator certification payments are now done online, so there's less manual having to manage checks and things like that, so that saves some time. And then we've done a number of IT improvements to just help do this routine tasks. So one example, we have a program that can go through SIDWIST and kind of identify systems back T results and compare that to results that they reported to us on their sampling. And we can identify where there's inconsistencies. And then we can target some compliance assistance activities to go out to those systems. And that's really helping us to reduce some violations and get some things in control that otherwise would not. And again, the more we can get folks in compliance, the less work we have to do on the back end to try to enforce and do those things. So all of those things have kind of helped us in being a little bit more efficient. Another thing that we've been able to do is the department created our central field office, and realigned some of our regional counties. So our field activities, our inspections, investigations, compliance assistance, we can all do all of those out of our central office and support the 9 central counties in the center of the state from Jefferson City. And so, and also we've realigned, I think it was 4 counties from Kansas City Regional Office to our Northeast Regional Office. And all of that is allowing us to reduce drive time to facilities. So we're getting our inspectors closer to facilities. We're cutting the drive time costs down, reduces our E&E for mileage, reduces the wear and tear on vehicles, all those kind of things. And we were able to do that with no additional FTEs. So we were able to take existing FTEs in our regional offices and programs and get those housed into this new group. And this group shares office space with us in our Lewis and Clark office building. So no new office space was needed. We didn't create a new regional office. You know, it's all formed out of our office. So this has been a big efficiency in our regional office and in our inspection area. And so that's the laundry list of those that we want to talk about. Anybody have any comments, discussion you want to discuss on any of that? Yes, Shelley.
Just a quick question about the staffing. There were reductions over the years. Do you guys have any plans on replacing those or bringing the ones on hold back in for going forward?
So the ones that were on there as reduced, I would say no, except for the ones that maybe were on hold. So like the OSA position that's on hold, that one is still fundable if we feel like we have the need for the position, but you know, right now with the funding situation, which we'll explain later, that position's been vacant for a while, and so we just elected to leave it vacant. But most of those other positions that I talked about were permanent reductions. The intern positions, you know, at some point, if we have the funding, we'll go back and we'll fund interns. You know, those are generally good projects. We can bring them into a real quick project for the summer where we need some help. And they get good training, and it's kind of a recruitment thing to try to bring, you know, staff on board. Those that are like the work when they come in, you know, it helps us to bring them back on later when we need to fill a permanent position.
For those of you that don't know what an OSA is, it's what we call a clerical position in state government. So.
Thank you.
Sorry. Richard Reminder, Director of Policy and Legislative Affairs for the Missouri Department of Natural Resources. When David talks about doing a permanent FTE reduction, that has been identified through the budget process and reduced from our FTE total.
Rich, do you want to use a mic? Sure. So our folks online can
Yep.
hear you.
For those online listening around the world, Rich Reminder with Missouri Department of Natural Resources, Director of Policy, Legislative Affairs. When Dave talks about a permanent FTE reduction, what we're talking about is a removal of that allowable FTE from the department's budget through the appropriations process. Therefore, in order for that quote position to be filled again, we would have to seek a new decision item through the appropriations process. If we've got a FTE that's on hold, we're just allowing that as a vacancy to sit until we determine what potential funding source may be out there, or we're reevaluating that need until we make a decision to either fill the position or to permanently eliminate it.
And so the only clarification I may make to what I said was that in MGS, we reduced the 1.5 FTE from drinking water funding, but they may have chosen to put that position on their funding. You know, they have other projects, other work. That was not necessarily a vacant position. They probably applied other work to that, but we've taken them off of our drinking water funding, so they're not getting funded out of our activities. The rest of them on the list were permanent. That list, that activity. Any other questions before we move on? All right, we finally get to let somebody else talk, which I'm very happy about. and so we're going to let Leon Lubring with Department of Health and Senior Services talk about their program and how that works. So Leon, I'll bring you the clicker.
Okay. My name's Leon Lubring. I'm the unit chief of the program that does the public drinking water testing. I've been there since '93, so a long time. The Missouri State Public Health Lab was actually established in 1906, and it was established primarily as a drinking water testing laboratory. So we have a long history of providing testing of drinking water to the citizens of Missouri. Annually, approximately, we do about 60,000 public water supplies. We are by far one of the largest drinking water testing labs in the nation. We also do about 6,000 to 8,000 private drinking water samples. Also, a service we provide is we house the EPA microbiological certification officer. They go out and they do assessment of microbiological private laboratories, and then they make recommendations to DNR to whether or not to issue them a certificate. A little history about how the Missouri State Public Health Lab received appropriations to the Safe Drinking Water Fund. In 2010, due to reductions in GR to the Missouri State Public Health Lab's budget, we requested a new decision item in the amount of $435,000 for appropriation authority in that. It was only for E&E, which is expenses and equipment. It was not for personnel services at that time. And currently, the personnel services or laboratory scientists are being paid out of the Missouri State Public Health Lab's general revenue appropriations. So the fund is not funding the scientists to actually do the testing. It's only paying, and I'll get to that in a little bit. That's our sample size. Again, we're at that 60,000 samples a year. It's probably been that way for the last 10 years. So it's pretty steady. We don't see that as declining at all in the next coming years. And that just looks at the impact, the public health impact of us doing the testing. The coliforms are still staying, positive rate is staying pretty steady, as well as the E. coli. So we're still seeing positive results by us doing the public drinking water testing. Oh, too far. And that just looks at a little bit our cost, our expenditures, and looking at projected expenditures. Currently, we're spending about $400,000 on supplies and personnel services, but our actual expenses are between that $600,000 and $700,000 if you add in what the Missouri State Public Health Lab is contributing in general revenue to do that testing. And there again is our projected 5-year shortfall. They go up, and that's based on a 3.5% pay raise and 1% infringe. And currently that is coming out of the Missouri State Public Health Lab's general revenue budget. And that's it. I know it's pretty quick overlay, but one of the things that we really are looking at is due to constant new prioritizations of Missouri State Public Health Lab's general revenue for such items such as Legionella or emerging viruses, we are looking to fund that through the primacy fee. Those 2.25 FTEs and scientists, we'd like to fund those through the primacy fee that are currently coming out of the Missouri State Public Health Lab's general revenue budget. So, any questions? So currently, the Missouri State Public Health Lab is funding 2.25 FTE. Those, as a scientist and part of a lab manager, they are spending that. They are actually doing the public drinking water testing. We are not getting anything from the primacy fee for personnel services. That's staff. And we're looking to fund those through the primacy fee just because we constantly have new prioritizations of the amount of general revenue that's funded to the Missouri State Public Health Lab, such as we have things like Legionella, new emerging viruses that are coming up. And so there's constant competition for those where that GR dollars are being used, and what we would like a dedicated funding to use for that private or public drinking water testing. That makes sense. And I think we've been very efficient at what we do at the Missouri State Public Health Lab. If you look at our costs are below $12. You're not going to find that value at even a private lab. And that's mostly because of the volume we do. We do about 60,000, which is a lot of samples. And we give services that private labs don't normally give. We have a courier system. It's in every county in the state of Missouri. Any public water supply that wants to use that service can drop their public drinking waters off at mostly local public health agencies. We get it the next day. It's free of charge. They can do the DNR samples as well there, and that's not even figured in that total cost. So it's a good value for what we're doing.
Hey, Leon.
Yes.
It's Todd over here, monitoring section. I would make a plug for the courier service that's provided. So the EPA audited the State Public Health Lab, found them the holding times are reduced from 48 hours to 30 hours. So from time of collection to initiation of analysis, a total coliform sample has got to be started within 30 hours. The U.S. Postal Service took out a couple sort centers in the state. There used to be one at Rolla. It's physically impossible to mail a sample from almost any part in the state to the U.S. mail. When this primacy rule and such went into effect, most samples were received at the lab through the U.S. mail. So without the courier service that's provided, most water systems could not get to the lab in time. And there's a vast percentage that use the courier service to mail the back T samples. I don't know if you know what that is, Leon, but
it's close to 99%. And our unsat rate for those samples that exceed that 30-hour rule is less than 1%. So it's more like 0.5% that exceed that. So the courier is doing a fantastic job of getting those samples to us on time.
Any other questions for Leon or about the Department of Health or their request for 2 additional FTE? All right, we will soldier on. And so now you should have all the background of the program, the size and scope of what we do, and those kind of things. And so now hopefully we've given you enough information that you'll understand some of the things we're talking about here as we go through the financial overview. So this is probably the information that you've been waiting to see as we get into some of the details of the funding challenges that we're seeing here. So this first slide, we had the question earlier about the types of fees that come into the Safe Drinking Water Fund. And basically, you can see here that the Safe Drinking Water Fund is the fund that was set up by statute. And that's where we're putting all of the fee revenues that we bring in from those fees we talked about, the primacy fee, the lab services fee, the lab certification fees and operator certification fees, and also any other miscellaneous fees that we get. You know, we charge sometimes for our sunshine request, so those would go into that fund. If there are settlements or interest or refunds, you know, those are the types of things that would come back into the Safe Drinking Water Fund. And so we talked a little bit earlier when Robert was here about, you know, what are primacy activities, what can the Safe Drinking Water Fund be used for. You know, essentially, the Safe Drinking Water Fund is used for implementing the Safe Drinking Water Law, which is basically the state statutes. And also it can be used for doing the primacy support and the lab services support that we fund through our 2 health labs, the health lab and our environmental services lab. You know, so it is a key piece of our funding situation. And I believe the statute is really, you know, the programs that we fund in the branch essentially all are in direct support of the statute. So there's really not an area of the program that is really not eligible to be used, you know, this funding for to support. And so here's a slide that just kind of shows you the revenues. So it's graphical. You don't see the numbers as much, but basically this is the revenues that come into that Safe Drinking Water Fund. And so you can see that the primary source of funding is the primacy fee. Um, so that makes up close to $5 million a year in funding. You can see that the other fees that come in, make up probably less than 10% of the funds that come in support of the primacy fee. What I'll note about, you can, on this chart, you can see the first 3 years are actuals. If you can't read the bottom, the first three are FY17, 18, and 19 actuals, and then the rest are projections. So in FY17, you can see that the revenues were lower. The reason for that, it was in that year, they actually changed the process and more people started paying their primacy fees annually instead of quarterly or monthly. And so we've seen some of those revenues actually move across the state fiscal year line. So instead of getting collected prior to June 30th, it got collected in August. And so some of those revenues drifted over into FY18. And so that's why you see a higher number there in FY18 for collections, because it was really some of the FY17 sneaking over into FY18. And then 19 is probably a little more reflective of normal. And then in our projections going forward, they basically looked at past fee revenues to try to project what they felt those would be going forward. So you can see we're projecting a little bit more than $5 million a year coming in through these fees over the next several years. So next, I'll just talk a little bit about some of our other funding sources other than the primacy fees. So we have federal grants, and this is a big portion of our funding. So we have two different federal grants. We have our Public Water System Supervision and Performance Partnership Grant. And so that's a grant that EPA provides us that is basically their support of our privacy activities. So I think that grant is around $2 million a year right now, or last year was around $2 million. And so that helps us implement our primacy activities, but it does require a 25% match. And so the match we use for this is the primacy fees, because the work that we're doing is primacy related, and we can use that funding in support of staff. The work we're doing supported by primacy fees meets the match for the EPA grant. And then the other funding source is our Drinking Water State Capitalization Grant. And so this is the one we talked about earlier that funds a lot of those set-aside activities that we talked about and can be used to fund staff and other activities such as that. We do reserve the full 31% of set-asides that come in with that grant. And this grant also requires a 20% match. So we talked about that's a $20 million grant. 20% match is $4 million. So, and one of the issues related to the match for this grant is the match has to be used for infrastructure. So we can't use our in-kind work that we're doing and implementing a program. It has to be money that goes in to support infrastructure activities such as loans and grants. And so our primary way of making that match is drinking water admin fees and also bonding of our loans and interest on those loans in order to generate new revenue that we can invest into our revolving loan fund. So this is one of the areas where we're having issues making that match. We got a whole section in the presentation that Hannah will talk a little bit later that kind of talks about that issue.
But we haven't mentioned the drinking water admin fee yet during, oh, you're going to explain it now? Great.
Coming up on cue.
It's a really important point. We should have like a big star on the slide.
All right, so other sources of revenue are drinking water loan admin fees. And so this is an admin fee of 0.5% on the outstanding loan balance each year on our loans out to public drinking water systems. So this one is a primary source that we're using for match for the capitalization grant. And it can be used to pay for reasonable cost of administering the state revolving fund program. So it's not restricted to only being used for match. We can use it for a few other activities. And And then our other source of revenue is general revenue. We have a very small amount of that that is available to us that we use in the program, but that is money that's appropriated by the legislature. That was on the clean water side. So I think we've been at 0.5% on the drinking water. Yeah. Okay, so here, this chart is kind of giving you the overview picture of our revenues. Again, those first 3 years are actuals, and then the rest are projections. But this is combining all of those sources of revenue, so you can see the fee-funded activities, the Safe Drinking Water Fund. We have our Drinking Water State Revolving Fund admin fees. We also have federal set-asides and our PPG grant included in here in general revenue. And so probably a couple things to point out related to this one. As you can see in FY19, there was an increase of admin fees used that year. That was due to an issue that we were having with matching our capitalization grant and with a delay in getting our performance partnership grant that year. And so we had to use a one-time additional funds from our drinking water admin fees to cover things that year. So that's why you'll see that one red dot there in FY19 larger than you see on the other ones. The big takeaway on this one is the impact you're seeing from our federal grants. So what we've projected in here going forward was, I believe, the FY19 grant level for both of our federal grants. And so you're seeing that carried forward in 20, 21, 22, and 23. But then in 24, you're seeing us take a big reduction in revenue there in our federal funding. And that's where we're running into this match issue that we're going to talk about. We're looking at projecting taking in a lesser grant in those years because of the inability to meet the match requirements. And so you can see that has a sizable impact on our revenues. That's about a $2.6 million difference between taking the full grant and taking a partial grant in those years. And so it's going to leave a pretty big hole in the revenues when you get out to the 24 to 27 timeframe. And I guess I will note on the footnote there, this chart does exclude drinking water state revolving fund revenue that's used for match. So you're not seeing admin fee revenue here that's being used for the match. We kind of chose not to put in a lot of that SRF funding in here because of the $60 million that they basically send out in expenditures. It would dwarf the rest of the chart. So just being upfront that you're not seeing those drinking water admin fees in here except for those that are being used for personal service type activities.
Yeah, they can't be used for anything other than infrastructure anyway, and so there's not a lot of options there.
But just so you're aware why we don't show the drinking water admin fees in here in a lot of these projections. All right, so on this chart, you're seeing the drinking water operating expenditures, and this is based on our current spending. We haven't projected any additional new items in here, so this is just based on existing spending activities. And you can see our expenditures are projected to grow. Most of that is related to personal service type activities. We put into these projections, a pay plan increase for staff. So I believe the projections were 3.5% in fiscal years 22 through 27 that we used in the projections. In FY21, I think we used 3%, and that was based on the governor's recommended pay plan of 2% plus an additional 1% for above and beyond type performance. But you can see that that is the main driver for expenses going up. It's the blue at the bottom there. And those other costs like fringe and indirect are proportionally going up because those are percentages based on the cost of personal services. So you're seeing those projections increase. The one thing that varies in there is you can see the pass-through funding is kind of up and down. And so that is based on the spending reductions that we've been talking about. We were spending more in the past. We've started to reduce spending on a lot of those pass-through services, and you're seeing those reductions. In 24 and 25, you can see it increase a little bit again, and that's because we projected for UCMR5 sampling in this. So that monitoring is projected to cost about $500,000, and so we split that over those 2 years, and that's why you see some increase in the expenditures there. So you saw the revenues going down, you saw the expenditures going up, and so this next slide kind of tries to show you that total picture. So in addition to revenues and expenditures, this one also shows the balance lines for our funds. So that top line is the overall fund balance, and then the lower line is the safe drinking water fund balance. And, so you can see the expenditures in the stacked areas of the chart in the background. So that includes fee-funded expenditures. It also includes our federal and other non-fee expenditures. And then you see the stacked charts, which represent fee revenues and non-fee revenues. And again, this excludes the admin fees and the state revolving fund. So you can see pretty clear on this that our expenditures are greatly outpacing our revenues, which are declining. And when you look at those lines, what that tells you is that we have enough funding basically in balances to make it through fiscal year 23. But when we get to fiscal year 24, we start now going negative in the fund. And so if we don't have a fee fix that can come in place to help offset this, we're going to be looking at pretty significant spending reductions that we're going to have to implement to balance this budget. And this is another kind of numerical way to kind of show you what you just saw on that chart. So this is the shortfall that you're seeing in each of those fiscal years. So fiscal year 23, you can see we're about a $3 million shortfall. Fiscal year 24, it grows to $6.4 million, and then it keeps increasing to FY 27, where you see a $7.5 million shortfall in that year. You do a 5-year average, and that shortfall is about $6.2 million that we're seeing in the fund. And so this lists the assumptions that you've seen in those charts and graphs. Basically, the expenditures, we're basing that on FY 20, which is this current year projected spending, not our full program cost. So we're looking at vacant positions and projecting some of those positions as being filled that are in FY 20. And then we're also looking at those cost of living adjustments that I talked about. So 3.5 cost of living, market adjustments above and beyond recognition, which is a new initiative that's being looked at, is included for fiscal years 23 and 27. So we're making efforts to try to maintain our staff. We see a high turnover in state. This is one way to try to move the state off of being the lowest paid in the nation. We have a governor who's been supportive of pay raises in the last couple of years, and so we have to make sure the money's there in the event that those things happen. So we're projecting that into our budget. We're also projecting a 1% annual growth on the fringe rate with a cap at 62%. And we have not projected any increase related to expense and equipment. So no inflationary increase is included in these numbers. But as we pointed out earlier, there is the big issue of the reduction in the capitalization grant in those years that you're seeing projected in those projections. So that was the current situation. And then now we have to kind of look at our crystal ball, because what we're trying to do with a fee increase is once that fee goes in place, we want to be able to fund the next 5 years of activities on that fee increase, so that we're not coming back and having to ask you guys again to to go through this process and help us with the fee structure. So we're trying to cover years fiscal year 23 through fiscal year 27. That's the 5-year period, because any new fee revenue is not going to come in at the latest the second half of FY22 or at the beginning of FY23. So using our crystal ball, these are the things that we thought would likely be new things coming our way that we're going to have to fund activities for. So PFAS monitoring is obviously something that I think everyone is aware is moving fairly quickly. There's a lot of congressional folks looking at this issue. We suspect something will move forward. EPA is currently supposed to come out with a regulatory determination. We expect something to come out in the coming months fairly quickly. Last I heard, it was at the Office of Management and Budget. And so when they come out with that regulatory determination, they'll start the rulemaking process if they choose to move forward with an MCL. And so we need to be prepared that we may have to implement that in this time frame. And our estimates are that's going to cost the state an additional $228,000 a year to implement that if that becomes an MCL. You all are probably also familiar with the lead and copper rule, significant proposal from EPA that is out for public comment right now. We're looking at the cost of that and projecting that it's going to be a significant impact to our program. And so the analytical cost is associated a lot with the school sampling and daycare sampling that's in there. So we're projecting that is going to be a big increase for the state to have to take on that sampling burden. And so we're looking at projecting about $41,000 a year going forward for the cost of that. Lab equipment, because of that new volume of work, our lab is going to need some additional equipment to keep up with that workload. And then as far as FTE, we're projecting 5 FTE at this point would be needed to try to meet all of those new requirements that are in there for water systems, and for us to do our regulatory role of overseeing those activities. And I'm actually thinking that's probably low. It's probably going to end up being more, but a lot of that is going to depend on what's in the final rule. It is a proposal. We don't know what will be in the final, but we have to be aware that there's going to be additional costs associated with that rule. Perchlorate monitoring, EPA is supposed to come out by June with a final determination whether they're going to go out with an MCL on perchlorate. If that MCL does get put in place, we're projecting it's going to cost us $107,000 a year to implement that monitoring program. And then we talked a little bit about asbestos earlier when we were talking about the vulnerability assessment and our monitoring and waiver plan. We're going to have to go out and do some one-time asbestos sampling at some of the vulnerable systems. We project that's going to cost us about $32,000 there in FY23. So you look at all of those future additional costs and you do the 5-year average of what those costs are, we're looking at another $890,000 in costs that we're projecting that we're going to need to plan for as we look forward for these fees. And so here's the summary of what all that means. So when we looked at the shortfalls, the current spending for DNR, we were looking at $6.2 million as the average shortfall. We look at that future needs assessment that we just talked about. We're looking at another $890,000, and then with DHSS's request for their FTE, they're requesting $205,000. And so when you look at the total shortfall picture of where we are, we're looking at $7.3 million of additional revenue that we need to generate. And you saw that those funds currently generate about $5 million. And so when you're looking at a $7.3 million increase that's needed, you're talking about almost 150% increase that'll be needed to cover those costs. And so this chart kind of summarizes that whole situation. So it's the same chart that you saw a while ago. The difference here is the new red area added up at the top that includes in it the projection of our future needs and the DHSS request for FTE. This is also a handout that you have, so we did hand this one out. I know some people don't like to just look at the graphical, so if you turn that over, You can see the numbers behind where we're at here, so you can see the balances in the fund. You can see the revenues. You can see the expenditures for both fee and non-fee related activities. And then that bottom part, you can see the future needs part of it that's added in. So this lines up with the information that we've been presenting to you in the chart. So, and so that is, I think, the last slide on this financial overview. But are there questions before we go through? We have one more part of the presentation, which is the capitalization grant, which will talk about that admin fee. So we're close to the end, and we'll be able to break for lunch here shortly. But just wanted to give you a chance to ask any questions on any of these slides that we just saw.
I had a question.
Yeah.
Not sure I understood in 2019. So I think what I heard was that the admin fees, the SRF admin fees, are the primary source of state match, but something happened in 2019 where you needed to use $700,000 of admin fees for another purpose?
Can you speak up and speak into the microphone, please?
The pace of our spending of our drinking water match was slow that year, and so they moved the things that were funded off the drinking water cap grant onto drinking water admin fees until we got our match spent and could start drawing on the new cap grant. And I think I heard Dave mention PPG. I think that was just a tongue slip. It was capitalization grant.
So
It was both. So we also that year were negotiating with EPA a lot on our performance partnership grant, and because of those protracted negotiations, the timing of getting those awards actually slipped, and so it was kind of a double issue that, you know, both of our federal grants were delayed that year. So we had to make a one-time shift to the admin fees to kind of patch that situation and get us through.
So let me see if I can restate that and see if I got it right. So the department was unable to spend the state match quickly enough, and so therefore it wasn't able to draw down the set-asides under the new capitalization
They
grant.
had used up the old cap grant and were ready to switch to the new cap grant, but we just hadn't used our match yet. And so they switched to admin fees for, I don't know, I think it was several months for those operational expenses.
I understand that aspect, but I think I heard David say that the SRF was spending $60 million a year. And I think there was a slide earlier that said $52.5 million a year in 2019.
Yeah, in that earlier slide.
That number doesn't sound right, but if you spent $52.5 million going out the door, how were you not able to spend $4 million in state match?
Well, it's about pace at that time of the year. The projects we got under construction at that time of the year, and I think it was it late winter, spring, Sarah? Was it? Okay, so yeah. So October timeframe, we're going into winter. We didn't have a lot of new projects. We had a lot of other projects wrapping up.
Okay.
And so it was just a pace
Thanks for
issue.
explaining. I'd like to maybe get some more information on that expenditure number for 2019. So,
What was that, Eric?
the 2019 number, the expenditure number seems order of magnitude off. So based on the financial report posted on the department's website.
So you had said you wanted something? I didn't catch what you
I'd
wanted.
like to understand that $52 million number.
Any other questions before we move on to this, which may cover some of these issues a little bit more?
Sure.
We'll get into the capitalization.
Okay. Thanks, Dave. Again, my name's Hannah Humphrey, and I manage our Financial Assistance Center. And I wanted to briefly, for those of you who aren't as familiar with it, go over a little bit how the Drinking Water State Revolving Fund works, and I'll try to make this quick. So the U.S. Environmental Protection Agency each year provides us with seed money in the form of a capitalization grant, and we are required to provide a 20% state match that we do need to draw down before we start drawing the federal funds. With this funding, there are set-asides that come out of the CAP grant that are used by the branch, as Dave has noted, and the remainder of that money, so 69% of the capitalization grant, are used by the Financial Assistance Center to provide loans and grants to communities for infrastructure projects. We are required again to do that state match. It's 20%, and the visual there just shows you that the funding that is revolving through that fund is state match repayments and EPA grants. So as we make loans and grants, the repayments and interest that come back in grow the fund. And also those repayments and interest, they must be also used as loans and grants to recipients. And so the use of the CAP grant, the associated match payments are all required by EPA for us to use those for loans and grants and some administration of the drinking water SRF and capacity development. This is a chart that takes a little digesting. I will walk through it with you. So as most of you know, SRF borrowers do pay an administration fee on the outstanding balance of their loan through the life of the loan. These funds are to be used for reasonable costs of administering the drinking water SRF and for activities that are allowed for the capitalization grant to be spent on, according to the federal regulations. So the gray line that you see there it indicates the balance of the admin fee fund for drinking water over time. And the light blue area, the area, is hovering around about 1 million, and that's indicating how much we receive in admin fee payments per year. You will see that it's declining in out years, and the reason for that is our projections don't include the new loans that we're making today. And that's the way that we do the projections, but I do anticipate that as we're making more loans, that number should actually stay at more of a steady state, so it should hover right around about 1 million.
So Eric, I don't know if this helps answer your question on the FY19. It wasn't that we didn't have admin fees. I mean, we had admin fees. What we didn't have was our grant to where we could pull down funding to support staff. So when you're asking about the $52 million in generating, admin fees, I mean, there was admin fees being generated. That's why they were available.
I don't think that was my question. It's hard to see from here, but is it $4 million there? I guess the question I had on the 52 million is my understanding that was the expenditures going out to fund loan and grants for the year.
These aren't loan and grant expenditures. This is operating revenue.
So maybe I confused you.
Yeah, I think I was asking a different question.
So Sarah just reminded me. I think the reason that number was so high in fiscal 19 was as part of that 2018 A bond deal we did. We had to do a $42 or $3 million investment. And I think that those expenditures in red are included in that, but we'll verify that. Right. So it would be considered more. Yeah. So I think that's the reason for that number. So what you'll see on your dark blue bars those are the amounts that have been spent or are anticipated to be spent for state match in those years. And of course, the red are operating expenses and these are all coming out of the administration fee fund. So what we're showing here is that we are going to need to, in the past, drinking water, in many years past, general revenue was used for match. That hasn't been possible for many, many years. If anybody's interested in the history of what we've used for match over time, I have that information. But for several years there, 17, 18, and it might be in 16 also, I think that admin fee revenue was used out of that fund for state match. And so we're seeing this declining balance in that fund. And once we use it in FY22 for our match, we're going to see that fund really tank. And so we've been talking about how we're going to be handling match in the future, and I'll get to that in just a minute. So I wanted to explain that, as we said, we spend the state match before we spend the capitalization grant. For those several years, spending was slower. We did have that investment we needed to make to help us as part of a bond deal to make enough for match. And I think you'll see that we're using that funding for operations much less in out years. So I want to shift gears for just a moment and talk to you a little bit about what is going on with drinking water SRF today, and its impact on the fund projections that you've been seeing in Dave's slides. Since inception of the drinking water SRF program in 1999, well, I think the program started a few years earlier, but I think these were the first loans. The total amounts loaned are depicted in the graphs here. And what we have determined is that the average loan amount, I mean, obviously it's very variable, but the average amount is about $20 million a year since the history of the program. The last 2 years have not been good years for us. We have a plan in place now that is aimed at a lot of activities and focus in the Financial Assistance Center on increasing our use of that funding to do larger projects. We're hoping for some of you to come and use our program. We would love to work with you. We've done a lot of streamlining. I think you'll be happy with the way the program works today. So while we are going to be making every effort to increase the amount of loans that we issue each year to strengthen the program and get it into more of a robust situation, we're in a bit of a hole now. And so we are basing future funding projections on the drinking water SRF's historical performance. And so if we are going to conservatively budget and make these projections, so we're hoping for the best, but we're planning for the worst, I guess, is what I'm trying to say. So if we're going to base this on past performance history, then we need to be thinking in terms of how are we going to make the match with an average of $20 million a year. And so we just feel that the most responsible approach is going to be a conservative approach. So with that in mind, now let's talk about our state match planning. So this is a critical activity to plan ahead for our drinking water financing program, but it also has critical impacts on the public drinking water branch's capacity development program and on their budget, because this is really a symbiotic relationship. So they've got the primacy program, capacity development, and we need both. And capacity development funds have been used for, I believe, 10% of assisting with primacy fees through the years. So if we need to take reduced capitalization grants from drinking water SRF in out years, it has a big impact on Dave and his ability to fully fund this program. So we are, let's look at the chart first. So the dark blue again is plan is spending state match with annual administrative fee income as it comes in. So we were able to use it in FY19 and 18. We did do a 2018A bond sale, and I don't want to bore you with too much detail, but I will say that our two practical options for getting state match money that we can use for match are administration fees, or we can take our portfolio of drinking water loans and we can take the interest from those loans and do a bond sale that generates state match proceeds for us. And then we just pay as the interest from those loans come in over the next however many years that we funded it through, we pay back the interest on those bonds. We pay the debt service on the bonds. It's a It's a tried and true method to develop state match. Our problem is that we've completely depleted our loan portfolio now. We have used almost all the interest in the drinking water SRF loan portfolio. And so the pressure's on now. We need to get some big loans in here so that we can do some state match bond sales. And also, complicating things are that current interest rates are very low. And so we've had our financial advisor develop some models for us that indicate in order to do a bond sale to get the $4 million or so in state match through a bond sale that we need, then we're going to need to do a little over $20 million in loans. We also will need to bundle a couple of years worth of bond sales together. You don't typically just do one each year. So we need to do a couple of big projects and get our portfolio built up. So that's a major focus of mine right now. So what you'll see in the chart is those blue bars are us using administration fee funding in order to make match. Your light green is, I'm sorry, I think I said that. I'm not sure if I said that reversed or not. Blue is administration fee funding. The light green is bond sale proceeds as state match. We are feeling pretty confident about our plans to close loans through 21. We think we did a bond sale in 2018, which is going to take care of 19, 20, and most of 21. Our capitalization grants from EPA did go up, which increased our match requirement, which was unexpected, which is why we need to add a little admin fee there in 21. For 22, we should be able to use administration fees, but at that point, administration fee funding will be depleted. And at the rate that we are collecting payments, it should be about 6 years before we'll be able to have enough in that fund in order to use administration fees for match again. So therefore, we are looking at between 23 and 27 at supporting match in the program through bond sales, pledging the interest of our drinking water SRF loans. And we don't want to, while we have big plans, we have to base our decisions on realistic expectations. And what I would like to say is, this is our worst case scenario. We're going to try to do better than this, but it is possible that in several out years we will not have enough money, enough match to receive the full capitalization grant, and we may have to go in with a lowered match amount based on our ability to do 20 million a year on average, and take reduced cap grants. And that's where you'll see the impacts to Dave on those out years that dipped. So, you know, the picture is going to transform. We're going to be trying to turn this program around, but we really wanted to explain the impact of the state match situation or our capitalization grant impacts on the budget numbers you're seeing in the shortfalls. Does anybody have any questions about this?
So just to clarify, so the projections don't show the $20 million per year average going forward in loans for the admin fee revenue?
These projections do, because what we're indicating is...
Why is that? Isn't it showing the revenue still going down over the years?
It is. What we're assuming is that even if that goes up, the average is around 1 million per year in repayments. So even if these goes up, it's only, you know, 100,000, 200,000. And so I still think it's going to take us 6 years. If we really went gangbusters and we had a lot of big loans, maybe in 27 we could use it. But if we're planning for worst case scenario, then we're looking at 18 based on 20 million in loans a year.
So I'm not focused on the state match, I guess, Hannah, the bars. I'm looking at the gray. It says revenue. Is that admin fee revenue?
Yes.
But it doesn't include future loans.
It does not. It does not.
I mean, if you're not making any loans, then you don't need the grants, right? So that
Correct.
Seems like a very conservative way to show that information.
Mm-hmm.
I'll just add that even at our $20 million generation, we're still only talking $100,000 to $250,000 additional every year in that admin fee.
Mhm.
So we can definitely go back and do a projection of what admin fee generation would look like. And we talked about that internally, and we knew that it was going to come up because Eric and I had a conversation about this ahead of this meeting that, we knew you were going to ask the question. So we can put it in there, but it really doesn't, as Hannah indicated, move our ability to use state match or do the state match out of the admin fee any earlier than what we've projected here, given the very low amount of generation. At least that's what.
Right. I mean,
that we
I think
talked about.
so Sarah and I had, had some discussions about this, and I think, it, it is averaged about $1 million. And so unless we do some really large loans, it's not going to decline probably, but I think it will stay more flat.
Sure.
Because we've got other loans falling off that have gotten through their 20 years. And so I don't think it will have a tremendous impact in drinking water. I do think, then, once we get to the end of this chart, then we're back to the green for many years. And so we're going to have to be having, this state match planning is going to be a very iterative process for us based on how robust the program becomes. And we hope it becomes very robust, but we can't guarantee that.
So I guess one statement and then one question. So I get the 100 to 150,000 based on 20 million a year, but that has a compounding effect. So like if you look at 2020, you're at $1 million, but at 2028, I think this is the last year below $500,000. And so if you compound that over the time, you say flat $1 million. That adds up. It's more than $150,000 a year after you start compounding each year that you don't assume that. So that's the statement.
I mean, even at best case scenario, we would move that blue bar from FY28 to FY27. I mean, that's what we'd be doing.
And then the other question is, so the use of admin fees is a recent phenomena. It started in the 2010s, I think. So what was done prior to that period for state match? Are there sources of other sources of state match?
While Hannah looks that up, I do want to, because she had the history of the admin fee, or of the match. She has that history. I wanted to point out that, the reason why this is an important conversation as it relates to how the admin fee fluctuates is because our ability to make state match for the capitalization grant is directly tied to 31% of that being available to fund operation. I just wanted to bring it on home to what Dave talked about earlier, that 31% is a huge portion of our operating budget today, whether that's those discretionary spending pieces that build up our cap development program, and then also, services or personnel services that we use to fund engineering and permitting work. All of that is coming out of that 31%. And so if we take less of a cap grant, because we can only afford to do so much state match, then that reduces that amount, and that's less services that we're able to fund through the program. So it has this trickle-down effect to the actual program operation as a result of our inability to get more loans out there. And I'm hopeful that Hannah's efforts will be reflective of our ability to bring in more applicants and close more loans. And I think those efforts are good, but it's just a matter of how do we do the projection? Do you feel comfortable as a group of stakeholders saying Hannah's group's going to be able to do $30 million worth of loan on average versus the history of the $20 million? Because there was a lot of ups and downs in that chart as far as I was concerned. Or do you want to scale it back to the average, which is $20 million is what the average looks like today? That's how we got to that number.
And the impact on Dave, just if you want the number, for 21 for the federal capitalization grant for drinking water, it was 19.8 million. So the 31% in set-asides that would be available to the branch would be $6.1 million. And if we went with a reduced amount based on us having less match, I think we calculated that that would be a reduction of about 2.5 million, I think, in capitalization, in capacity development funding for the branch. That's a lot of, it's a big hit.
How did we make state match back in the day? Was it general revenue?
So I just pulled that chart up right before we started because I thought this might come up. So for drinking water from 1987 to 2003, it was general appropriations from general revenue appropriations. From 2000 partial 2003 through 2011, it was leveraged bond sales, so state match bond sales. In 2029 in part of 2011 and 2012, it was, I believe, rural sewer grants that were from a geo bond sale. The rural sewer grant program is funded by geo bond sales that are put together by the Board of Fund Commissioners, has to be authorized by the legislature and the governor. And then again in 2013 and 14, it was also leveraged bond sales. And then in 15, 16, and 17, administration fees. 2018, 19, and most of 20, it will be state match bond sales.
So just to add to that, we explored whether or not we wanted our shortfall in budget projections to include requests to the General Assembly for state match dollars, and we've opted to go the route of a combination of bond sales and utilizing the admin fee generation from the SRF loans as a reliable source versus something that we have to continually be going to the legislature and asking for general revenue.
But that, Chris, does that come with reduced grants in that approach?
Say that again?
Does that come with reduced federal grants in that
Cap
approach?
grants?
Yes.
Our budget projection, yes, does include a reduction from the 1.7 to the 1% because of our projections don't show that we will have the ability to make match or leverage that interest because of lackluster utilization of the SRF on the drinking water side.
Look, just to be clear, we see the need for the state match, and we think it's an important issue as well. And so you're right, it's a matter of shifting the when it's needed, but I do think that the numbers should show a fair projection, whether it's 20 million or 10 million, assuming no loans, I think is way too conservative.
We'll put that in there and get that portrayed somehow. We'll make sure that you at least know what that looks like in the projection.
And then last, so we can go to lunch, I just think that...
You hungry?
I am hungry. But and other people can join in as well. But, I think the department should be commended for going, since 2003 on state match without state revenues. But if the option we're looking at is you got to reduce cap grants and this federal money, it seems like there should be a conversation had about, what sources can be had to utilize the full grant funds.
So, Rich Reminder, again, Director of Policy and Legislative Affairs. One of the things that isn't contemplated in fee discussions as it relates to our fee-funded programs, we rely on, number one, on the historical data and interactions with the General Assembly, where we've seen reductions in general revenue over time and the reliance on fee funds. The likelihood of a reliance on general revenue to resolve those issues is relatively low. In addition to that, and we're currently having this discussion in relation to hazardous waste fees as we've evaluated that program, the fee structure process that is set out in statute, the reason why we're here today, recognizes that we need to be having conversations close enough in advance of a projected revenue shortfall that folks can understand the need, but at the same time giving us as a fair bit of room as possible that if we have to evaluate those other options, then we can certainly go and do so. But a projection of a reliance on general revenue is not something that we believe would likely to be successful at this point in time, but it's certainly a component of our continued discussions. Just want to lay that out there.
All right. Any other questions for now, or are folks ready to go for lunch?
Well, at least the restaurants won't be busy.
All right. So, okay. Sure. So basically, we're at a good stopping point. We've gotten through all the slides now and laid out all the information. I think now is a good time for that lunch break. You can think about the things that we talked about, and we'll come back. And how much time do you guys want? Do you want to go an hour, or do you need a little longer, or?
I think you should at least plan for an hour.
Right. So if we could come back about 1:45, then we can just have some general discussion, talk about the things that you heard today, what other information you want to know about, that kind of thing, and kind of figure out a path forward for future meetings and those kind of things that we need to prepare for. So with that, we'll take a break, and we'll try to be back here at 1:45. And there is a list over there on the wall of restaurants nearby. So if you're not familiar with the area, they have that on the board over there.
Yeah, I'm gonna get some. Westphalia so much. I'm from Argyle.
Oh.
Yeah, so mostly Weberg's from the Vienna. Yeah, I figured as much. You look like a Lubering from that way.
All right, everybody. Appreciate you coming back after lunch. Hopefully, we didn't scare you off too much with the first part of the presentation today. I think in the afternoon, we'll kind of first just kind of see where the conversation goes based on what you saw from the presentation, anything that you want to talk about. We do have some other handouts and some things that we can use to help guide the conversation for the time that we have left today. And so we'll kind of get started there. I think Ed wanted to have the opportunity to say a few things before we get started.
So, yeah, thanks, Dave. The pay plan that's in these projections is basically a 3.5% annual increase, and there's two components to that. One is COLA, and one is what we're calling well, we used to call it merit pay, but we're performance pay or above and beyond. The 2.5% is basically based on the governor's recommendation for FY20 was 3%, and that was approved by the General Assembly and is in the current budget. He has proposed 2% for FY21. So we're in trying to sort of read the future of COLA. We averaged those two and came up with 2.5%. And we have talked to the governor's office about that. So we are that's why we settled on that number. And the 1%, I just real quick, we looked at our turnover rates in FY18, and we were turning over at a rate of about 25% for our environmental specialist 2 positions, as well as about 25% for our engineering positions. So we always expect high turnover in our agency. We know that we are a training ground. We are in some respects an entry level type of position for professionals that go on to do other things and work other places. But 25% is too high to do as an effective job as we need to do. So the 1% is really our attempt to get some better staff retention in the agency, to lower those turnover rates so that we can provide better service, because more experienced staff make better decisions, they make faster decisions, and so I just want to put a plug in for our rationale and our thinking behind that. So that's all I want to say. Any questions? Okay. Thank you.
All right, thanks, Ed. So now that you had a little bit of chance to think about the presentation materials, were there any other questions that folks wanted to just ask now, or any topics that you wanted to discuss? It's kind of open discussion time, so however you want to. Susan.
Why did you decide to do a 5-year projection instead of a 10-year?
Well,
7 or 8 years, something else that would take us out a little further.
Sure.
Very
right. It's really hard to project out that far, what costs are really going to be there. I think it was kind of the department's determination that, we talked about this as all the programs together. How should we approach this? And I think we all decided that, a 5-year window, once you're getting the revenues, would be an appropriate window, because it does take 2 years, first of all, just to get the rule in place and to start collecting. And so then another 5 years that we're planning and projecting here. So it's really 7 years from now is the time period that we're looking at. So it's kind of almost a 7-year evaluation. But, it's hard to project all those costs. And if there are unseen costs you're not aware of, you may be coming back anyway to have to try to address that. So we just thought this was a reasonable time frame. And if we keep projecting out too far, the fee increase has to be larger, right? So you look at the shortfall window, we did it over a 5-year, and you have this $7 million shortfall. Well, if you got 10, that number is going to be a lot bigger. And you're talking about a larger fee increase a lot earlier in the process than you probably need, because you would be bringing in a lot more extra revenue in those first couple of years as the expenses are lower, and then as it gets higher, you would start paying that off out of a balance that's in the fund. And so we just thought it was a reasonable amount of time period to try to cover where you're not really making that shortfall calculation too large.
There are a couple other presumptions that are made when you're trying to do your fee calculations. Number one is a recognition that nobody wants to be put in a position to pay more than they have to in order to get for the services that are being provided. So if you're doing that fund projection too far out and basing your fee calculations on that, then you bring in that opportunity that you're potentially having to pay significantly more fee on the front end than what is being provided. The other factor being in the way that fees are established for agencies, they're set at one static point in time. We would make a decision, the potential to make a decision whether the fee is established in statute or it's done through regulation. We set it on January 1st, and that's the fee amount, and that will continue to be the fee amount until that fee changes. So what you have is a fund balance that is developed and built up over time, and then slowly drawn down until you have to have that discussion. What we found is not only have stakeholders kind of generally that deal with the agency prefer kind of that 5-year looking time frame. We've found that a fee typically has a life cycle of solvency of about 5 years. So when you set it, by the time it draws down over that period of time, roughly in about 5 years, you're back to having to look at, what else would you like to do? I know there's been discussions on fee issues in prior years before this process existed about, having automatic inflationary adjustments or COLAs as components of the fees. And that's something that has not been something that stakeholders or members of the general public have routinely accepted as a component of a fee-funded agency. So those are some factors that go into trying to figure out, okay, how far down the road do we need to look to determine our solvency, and what do we think is a reasonable time period for us to have today's conversation, and looking forward, when's the time for the next conversation? So I hope that helps.
What are others thinking? Liz?
Just for clarification, so I've been focused on primacy fee, and I don't know why, but I just have. But we're talking about possibly increasing all of the fees we've discussed today, the operator certification fees and the...
So the way that the legislation is drafted and what we have the opportunity to do through this process is to look at all the fees that are assessed by the department.
Okay.
We have the ability to turn some up, turn some down. It's open. That's why it's open to that discussion of, is there a preference to go one particular route or another? For example, when we had the discussion on hazardous waste fees, the stakeholders in that discussion looked at the tonnage generation fee and decided that they did not want to adjust that fee. They only wanted to focus on the permit fee that was paid. So that's certainly an opportunity for us to have that discussion in this forum throughout this process.
Okay. So my next question onto that, David, do you have...
Yeah, I would just say, we wanted to make sure everyone knew all the fees we had. So in the presentation, we wanted to make sure we laid out all the fees, all the revenues. It's really up to this group to decide, whether they want to just look at primacy fees or we want to expand it beyond that. When you look at how much those fees may have to go up, folks may want to feel like they need to look at some of those other fees to try to help cover some of that shortfall rather than putting all of that on the primacy fee. The other thing I would say, though, if we're going to move into that direction and we want to talk about operator fees, we probably need to do some additional outreach and try to reach out to some operators. Several got this notice, but it wasn't really targeted at operators, and since they're more directly impacted, we may have to do some additional stakeholdering there with them. The one thing I'd say about those fees, though, is they don't necessarily have to follow this exact process, in my mind anyway. Maybe Joel left, but maybe he would disagree with me. But the primacy fee and the lab services fee are specifically in statute with an amount and caps and those kind of things.
Oh, okay.
And so when we're going through this process and all that extra stuff I was talking about this morning, about how that has to happen, it's because we're changing the language of the statute in our rulemaking. And so there's an extra part to that. But when we're talking about the operator certification fees and the lab certification fee, those are things the commission has set in rule. And there isn't a limit in the statute already. So we're not having to revise the statute to go through that process. So I feel like those fees could be done on a different schedule and with different stakeholders, if necessary, that are more impacted by those fees as part of the discussion. But the primacy fee and the lab services fee are specific, and those would have to go through this longer, more detailed stakeholder-driven process.
So my next question then is, I know the primacy fees were increased in 2006. What about the other fees we're talking about? Have they been increased since installed?
I don't think so.
Are they the same?
Run back and look at the slides we talked about the last time. All of them were updated earlier. And I think the lab services and primacy were on the same schedule. And some of the other ones were a little different. So privacy, 1992 was initiated, 2006 was updated, and it hasn't been updated since 2006.
Right.
And then the same with the lab services fee. So it's on the same schedule.
Right.
And then on the lab fees, it was in 1992 and has never been revised.
Never been revised.
Never been
Okay.
revised. And then the operator certification fee was established in 91 and revised in 2001. So last time it was changed was 2000.
This is when we made all those changes to the OPSRT regulations. Then.
But I don't think that in 2001 it changed the fees. I think
there you are.
I think the fees for OPSRT have been the same since that 91.
Okay.
It was just renewed, or?
Yeah, there was an addition in 2001 that added the requirement for all of those non-transient, non-community systems to have certified operators, but the fees were kept the same.
Okay.
And before 91, the fee was $15 for an exam, and it bumped it to $45.
Right.
In
Okay.
that, yeah.
Yeah, that's what I recall. Yeah, 2001 is when we did the whole overhaul and to meet the Safe Drinking Water Act.
Yeah.
Requirements and stuff.
Basically, those fees haven't been revised since 90.
Since
Right.
the early 90s. Okay, thank you.
Right. The admin fee, the question was about the admin fees, whether those are statutorily derived. And I believe the answer to that is they are in rule. You know, I think they're in that fee is in the SRF rules at a 0.5%. So that one, I guess in theory, could be changed without having to go through a statutory revision. What other questions do folks have, or issues that you want to talk about? All right. Well,
Excuse David, are we just looking at fees to make up for the shortfall? Is that the strategy?
yeah, as far as, you know, the federal funding, you know, we projected it what it is, you know, we have no control over what that is. I think as Rich and others have mentioned about general revenue, it's not a likely solution that, you know, the legislature is going to be agreeable to general revenue. So what that leaves is the fee piece of the equation, especially if we're talking about SRF admin fees and trying to reserve those to be made to make the match. So that really leaves fees as the only way to make up that difference. But like we said, we're not particularly trying to lay out the course here. I mean, we can look at any of these fees. We could focus on the primacy fee. You know, we'd like to hear what your thoughts are on that. You know, it's effort. Do we need to go forward and looking at all of those revenue options? Do we need to come up with new ones? I mean, we have backflow certification that doesn't currently require any kind of fee. We have the BACT labs that we're currently not requiring a fee. We have permitting that doesn't require any type of fee. So there's a lot of things that we see in other programs that have fees, and we're not coming out and trying to suggest that we need those things, because the conversation in my mind is a little bit, do we want the primacy fee to cover a lot of this cost so that we don't have to have all these other fees in place? Or there's the conversation that maybe this area is not funding their share, and maybe they need to have a little piece of funding to the equation so that the primacy fee doesn't have to be raised as much. But that's kind of the discussion we want to have with you guys and get the feel for where your thoughts are on those kind of issues.
And it's also partly that, you know, the presentation that we've given is we've identified the drivers both from a revenue side and from a funding side, or from a cost side and expense side, that determine, you know, the situation that we're ultimately going to be in. So, you know, the question is, you know, do you agree with those, with what we've presented? Do you disagree with what we've presented? Are there things that we are providing service-wise that are not necessarily mandatory, but they provide a service to the fee payers that you want us to continue, that you want us to reevaluate? I know it's kind of a lot to put out there, but it really is an open book to have that conversation to figure out where we need to be going forward and where we want to be going forward.
Have we taken a look at any other state funding models? Is that all?
Yeah. Okay.
to see if there's any other funding model that may work or open our eyes to something that we haven't considered?
I don't know that we've done that work, but certainly this forum is one where we can go back and put some data together or see what's out there and see if we are really that different. And if anybody has an opinion on that, we're certainly open to understanding that.
I mean,
So,
one thing I would say is, you know, it's not always an apples to apples comparison, you know, because like we laid out, we have this additional requirement to provide the laboratory services. So we go out and we look at other states, they're not necessarily going to provide that level of service. So, you know, their fees may not, you know, represent those kind of things. You know, they may have other kind of fees. Some may have permit fees. Some may have, you know, operator certification fees may be a lot higher than ours, you know, and some may be lower. I mean, so it's going to be kind of all over kind of the map, if you will. So it's hard to compare, you know, individual states sometimes. And, you know, the size of the state makes a difference, the number of water systems they have, all those kind of things. So everybody's a little unique.
We were talking at lunch about a state that has their program includes where they fund the person to go out and take the sample, not just the labs piece, but also to take the sample and make sure it gets taken correctly and follows those protocols, etc. And that's a huge expense. And so obviously goes back to Dave's apple and orange analogy. It's really tough to do the state-to-state comparisons. One of the things about additional fees that we might talk about, or at least throw this out there, there's different permitting type activities that, you know, right now we don't charge for new permits, new permit to dispense, construction permits. We don't have, like on clean water, we have an annual permit fee that's assessed based upon flow and size and things of that nature. That's not analogous on the drinking water side, and so there's a lot of different touch points of work associated with permits that maybe we don't necessarily have a fee category for on the drinking water side. So something to consider. Not something that we're coming out and proposing, but definitely something to consider.
So question, I guess, from maybe for several of you, but I heard what Dave said, that there, you know, not much really hope for the general fund really supporting much. But I thought what I heard you say, Chris, that was something you guys had kind of modeled into what we saw earlier, that there was a portion of that was still, so we're getting more from the general fund and then the rest of these fees we're talking about.
I mean, there is a small sliver of general revenue that we currently get that we use for drinking water. I think it was on one of those charts. We don't plan for it to go up, and in fact, it through the processes gets kind of attacked every year. You know, it's one of those things that is just part of the legislative process anymore, is for folks to get questioned about the amount of general revenue that they're receiving. But that was good. This slide, next slide. Yeah, there's your revenue slide for the primacy, or the next one. Right. So that little orange bar across the bottom is general revenue currently.
The reason I bring that up, I guess, is just from the very last part of the presentation on the capitalization grant piece alone, right? So I mean, again, I know we all should pay our fair share of whatever services we're receiving, right? But I also heard, you know, they're wanting to loan more money out of the drinking water fund, right? They want large loans, which I understand the reason behind that. But to me, if the state is at risk of losing their capitalization grant funding, right, or a portion of that, I would think the general legislature would be more interested in it than what they appear to be. So that's my takeaway from that.
yeah, so as a whole, as an agency, just to give you a perspective on where we sit in terms of relation from general revenue to our other fee sources or our other funding sources, we are funded at a rate of roughly 96% fee or other funds, only 4% general revenue. Of that 4% general revenue, a significant portion of that, somewhere a little over 2% of that, goes to the Water Resources Program, which is for construction of large drinking water reservoirs, and support of Missouri Geological Survey. That other 2% is distributed in various components throughout the agency. The only expectation that you can largely make on a year-to-year basis for a general revenue increase is when the General Assembly makes a decision on the cost of living adjustment that we're talking about as one of the big drivers for our fee funds. And the reason that is that's important to understand, and why I know it's a frustration to folks, is when the General Assembly makes a decision on a cost of living adjustment, they are frequently only looking at the available general revenue in order to make that decision, not looking at its effect on fee funds. So when fees are established, and if we do not calculate in cost of living adjustments, and I know that we've done this with other fee funds when they went through this process back in 2013 to 2015, if there is no cost of living adjustment estimated in those, that 5-year build out period that I talked about quickly shrinks to 3 years or less, depending upon what those decisions are. If we enter into another economic recession, which is certainly a possibility, then the first pot of money that the Department of Natural Resources is tasked with identifying as available is general revenue, in order for it to meet the other priority needs that we have in state government. So it's being a fee-funded agency means that we are in some ways less affected by general revenue determinations, but in other ways we are more affected by general revenue determinations. But to your point, if there is a critical need or an assessment, that is something that we will take to the General Assembly at that particular point in time. But we project out much further on our fund balances and what we see coming down the road than what the General Assembly typically does on their own, and then they can only budget for an individual upcoming year. So they're only looking at putting general revenue in for the upcoming fiscal year. We can't go make a request for something 3 years down the road. That would be something that would be easily dismissed. So, if we're at that point as we have these discussions, and these discussions also influence what we put into our budget if we need to make a request for general revenue. But as noted by what our projected shortfalls are, the availability of those funds is very difficult. There are several tax cuts that are yet to be triggered by legislation that was passed a couple years ago, and then given everybody a larger sense of the budget process because it's part of what drives this. But the inflationary mandatory spending that we have to do, particularly driven by education requirements in the Constitution, and then through the entitlement programs, particularly on the healthcare side, eat up a larger portion of that general revenue pot every year. So if general revenue growth does not exceed the mandatory expenditures that come into those programs, we are no different than any other agency requesting general revenue. So your point's well taken. I just want to make sure folks understand the challenges that exist there and the reality of reliance on success in that avenue. But it's definitely something that's a tool in the toolbox as we all have these conversations.
Yeah, the bottom line is the same people paying the bill. No matter where it comes from. So.
Well, I'd even jump and go further than that. I don't know if it is the same people. The state revolving fund is primarily used by public entities. So you got water district across the table, you got municipalities. The investor-owned and privates don't use the state revolving fund, and so they're not helping achieve this 31% that's being used to fund staff. And so I think there's a disproportionate burden placed on the public systems because they are the ones using this money. And so
we did one clarification there. So we made that change this year where the investor-owned companies can use the drinking water SRF. So it's not true on the clean water side, but on the drinking water side, we have opened the door, and we're working on a loan right now with Missouri American.
Sure, and I understand there's a current one open, but that door has been opened. It's been open for a long time, and so maybe that will grow.
Right. I mean, but I think this is the first actual loan with them. So, and I think
understand.
I think it'll lead to more.
And then the other thing, I think, Rich, to your point, um, we, I think the stakeholders acknowledge it's a big ask to go to the General Assembly for money. But I think what we're seeing here is for 20% of the money, you can get, you can put in $2 and get $12 back. And what we're seeing here in the projections is instead of getting that $12, we're getting no dollars by taking a reduced grant. And that seems like a compelling story to tell. And I think there's other options than just the general appropriation. I think there's also still statutorily authorized general obligation bonds for water projects that's been looked at in the past for funding state match, and that could go out for multiple years.
All right. One thing that I thought we could look at, we did have one handout that we really haven't talked about that might give you a little more detail on a few things. It's the one called FY19 operating expenditures. And so the purpose of this chart, we wanted to kind of lay out for folks. A lot of times when we go through these meetings, they want to see what does it cost to do individual types of services. And so this chart kind of lays out for FY19 where we expended our funds to do certain activities. So the column on the left is basically activity codes that we use in our time accounting system, and that is tied to the number of FTE, and also we tied it to the source of the funding. So if you're wanting to see, where is inspections funded out of, you can see we funded 19 FTE, and we fund most of that through federal. We had 624,000 in federal, but we also fund some of those activities through Safe Drinking Water Fund also. And so it costs 1.5 million when we look at the cost of personal service, E&E, and those kind of things to run our inspection program. And you can kind of see where we're paying that money out of. And you can look at all the different, types of activities we do, whether it's compliance assistance, whether it's monitoring, whether it's enforcement, training, all of those. These are pretty much the only job codes that we fund drinking water funding from. So you can pretty much see where we're paying for each of those kind of services, using what kind of funds, and how many FTE we're allocating to that effort. And again, this was based on just FY19, which was last fiscal year, last year of actuals. So it should be fairly representative of where we are kind of right now with those kind of activities. So I think that's kind of a useful chart. I know a lot of folks in the past have asked, well, how can you show, what it costs to do certain services? This is kind of the attempt that we made to try to outline that for people, so you can kind of see how we are using our funds and where we're using them and how we're providing them. So I thought that'd be a useful handout for folks if you need to take that back to kind of evaluate things and see that picture of the program. So any questions from your quick look on that, or anything that drives in a conversation or a question? Other things that we can show you that we've worked on here. As we do with a lot of our stakeholder efforts, we have developed fee calculators. And so we can share this and put it out on our webpage along with, we'll share all the things that we're talking about today. We have a stakeholder webpage. We'll put the presentation out there. We'll put all these handouts out there. We'll have our recording of the meeting for stakeholders who weren't here today who need to catch up. But this calculator basically will show you the current fee structure the current number of systems that are paying into those fees, and you can use it to kind of develop, what a fee increase in a certain category would look like. So this one's the primacy fee. If you look at this calculator, you can see it's got our current structure with the different water system sizes of connections, and it has the number of systems that fall into that category, and the total cost there. And so you can come over here and you can see what the current fee structure is, and you can see what that would generate currently generates in terms of revenue. And so in this blank one, you can go in here, you can play with numbers, you can see what different types of fees would look like, and it'll show you the amount based on these data over here, what that would generate. So we have one of those for primacy. We also, this one would be kind of a tiered approach to primacy. So this one would work if folks are thinking that it might be a good idea to try to stage in a fee increase. We built this one so you could do a year 1, year 2, year 3, plug in different rates. You could see what it would generate each year as far as revenue. Then we have one that was built for the lab services fee. So you can see the different types of systems. So the transient, the groundwater less than 4,100, the 4,100 to 7,600 and 7,600 or more surface water. You can see the number of systems currently paying into that. Then you can see here the current fee rate. Then you can see down here the amount that fee generates each year. And so then you could go in and look at examples and see what that would generate if you put a different amount. And this one is for the lab certification fee. Same thing. You can see the different types of labs that currently are out there, the fees they currently pay, the number of those systems, and the amounts. And you can see what that generates each year. You go in and tweak that to see what a fee change would make. And then we have the one here on operator certification. Same thing. You can see the different fees, different amounts, the number of inputs related to that, and then basically what it would generate. So these tools can kind of help in the conversation of, what would a fee change look like? We can use these tools, add in different variables, see what it would generate in the realm of a fee increase, and put together proposals or plans that might help address the shortfall situation. So it's a very useful tool, and so I just wanted to kind of share that with you guys, and we'll make it available so you can take it back and look at it, make those adjustments yourself, see kind of what a fee would be, and how we could generate revenue.
Do you want to clarify that on the primacy one, it's set up to take it times 0.98 because the systems retain the 2%. So you all have the formula set up so it calculates only 98%. So we
got
of revenue.
The little footnote here. So the formula is kind of set up to address that piece. So primacy fee. So it will automatically calculate, the 2% when you put in the numbers. So that won't be shown in the totals. Same with a lot of the fees. So there's some in here that are 3-year fees. You can't necessarily see it from the input, but it divides it by 3 because it's a 3-year fee. So you would see kind of what an annual input would be, like on a lab certification fee. Those are 3-year fees. And so the calculation's built in to automatically divide it by 3 so that it kind of shows you over the 3-year period what that would bring in.
Dave,
Yes.
over here, Gail White.
Again.
I'm from one of those small water sewer districts, and I am really surprised that our group is categorized, and that's the largest, is at 1 to 1,000. We talk about what the cost is, and it's the biggest fee, $3.24 per person. Other than the next category, the 1,001 to 4,000, we're paying the most, us small guys. So I don't know if there's a way or how it was originally set up. I see, the original fee was $2, then it went to $3.24. If there's any consideration at looking from 1 to 500 and 501 to 1,000, I don't know if there's, but for us small people, and I realize your example that you gave before. We may be paying $45. Well, for $45, if you've got 2 condos in a small housing division, as we do, that's a big chunk. We're an all volunteer board too. I mean,
Sure.
that which is probably unusual, and probably most of the people sitting around here are not kind of in my same position. But it is a concern, and since you're asking for input, I'm providing mine.
And we appreciate that. And so what I would say is we can look at these tiers and we can change those to whatever we feel like is appropriate. Part of the being able to revise the fee structure through the rule is that we don't necessarily have to keep the exact same approach that we've always had. So if we feel like, for an example, maybe we shouldn't have the smallest systems have to pay the lab or pay the connection fee, and we charge them a higher lab services fee, because if we have a system with only one connection, that's a $3.24 bill. I don't want to be sending out a check or a bill for $3.24. It's probably costing me $25 to send it out and to get it back. So something we could look at would be maybe the smaller systems that are, under a certain threshold, 15 connections or something. They either pay a minimum fee or they don't pay this fee and they pay a larger fee on the lab services to offset that cost. I mean, we can make those kind of decisions in this group, and if the commission agrees with that approach and approves the rule, and the legislature doesn't disapprove it, then it will go through. So don't feel like you're always limited to this, but if you have ideas that you want to see in a calculator, like, that's trying to build in some minimums or things like that, we can go back between meetings and work on different calculators and proposals and try to come up with, ideas to show this different. But that's the kind of feedback we need. What do you need us to work on between now and the next meeting? So when we come back at the next meeting, we can have a productive conversation about how to potentially make a fee change and that makes sense to people. So if you have ideas that you're thinking and you want to share those with us, we can go back and work on that and then try to come back with something for the next meeting. So definitely would like to hear those kind of thoughts.
Do most of the utilities collect these fees outside of their rate structure, or do you have that information?
Well, so as far as the primacy fee, the way the statute is written, they should be, it is pass-through fee. So they're supposed to have it separately enumerated on the bill that it is the state fee, and so I assume that would mean that you wouldn't have to go ask for rate increases and things like that because you're passing through our fee to the customer and it's not your fee for the service. So when we change the amount, you would be able to show that instead of a $3.24 fee, it's now whatever, $4 fee, $5 fee, whatever that number is. And, it would be passed through to your customer. You collect it for us, you retain the 2% of whatever that fee is, and then you remit that to the state as our fee. So I think that is the way the statute is outlined as how that's supposed to work.
Yeah, I understood it was. I just didn't know if that was the practice because I think it's been embedded in the rates in some utilities.
Yeah. We wouldn't necessarily know that. I don't think it's part of our inspection to normally look at the billing and that kind of thing. So it's not something that I would guess is probably a focus, when we go out and review system records and that kind of thing. We generally send them the invoice and they remit the payment. It's not we don't go and really look at the billing to see how they accomplish that.
David, I do a lot of rate studies for smaller with Missouri Water, and I would say 99% of them have a separate line amount. They separate it out of their fees, and it's on the bill. And they can bill it either monthly, quarterly, or annually. And by far, the majority do it annually, one time on the bill, and then it's done. So, but yeah.
What other questions, information are you guys thinking right now? Yes, Susan.
It seems to me that we can think about taking costs up on our various fees, or we could think about what services we think are wonderful that we must keep, and maybe some services that the state provides go away, and then maybe fees don't have to go up. So that would be another way I think people should think about it is, are there some services that you as a water utility would want to be providing at your dime instead of having the state provide it on their dime? And could you do it for any less money than what the state does? I mean, it seems to me that what we get out of our lab, the state lab, is wonderful, and the courier service is terrific, and probably nobody could outcompete those, the price we're getting. So maybe we definitely want to adhere to their request and honor it, that they get some more FTEs. And if we have that cost going up in that area, can something else go away that the state does? I mean, we all do that with our personal budgets. We juggle what's a priority this month and what isn't. Only I guess it's years now we're looking at.
I'm trying to go back to the services because there is something that I want to point out. So these are some of the set-aside projects. So when you're talking about some of these activities, you know, we're talking about what's that? Oh, sure. Yeah, I'm not in presentation mode. Now, so here's some of those services that we're talking about, and like the engineering grants is one, you know, that I just wanted to mention. Because we talked about how we were thinking about shifting that over to be funded out of our state revolving fund. You know, so if we're thinking, you know, that's something we could do away with, it's really not, you know, because we already shifted it out in the projections. So we're showing it in the projections now in 21 going forward, not being in the set-asides. We're showing it being in the SRF grant program. So if we reduce that, say, off the board, it's not going to be a net savings that's going to help in an effort to reduce cost because it's being funded out of that grant program. Now, we could use that grant program to fund some other activity on an SRF loan, but it wouldn't be able to be used to fund staff or anything like that. So there's limited use to doing that. And probably the only other point I would make is that there is a statutory provision that says that we have to fund at least 2% of the set-aside grant to fund training and that type of activity for water systems. So we would have to meet the obligation of that statute, which, you know, would probably be another $300,000. And these programs are some of those that are designed to do that. So these ones in particular, there is some room to do some things with that, but like we talked earlier, we have already kind of cut the university programs off of that list and the source water protection grants. So really the only things out there is the voucher program and the circuit rider contract.
Can't get rid of circuit riders.
Well plugging grants that are kind of services that we could look at in that way. So just wanted to throw that information out there if you guys think about it. So what do folks think would be useful for us to prepare or put together for a future meeting? Is there information we didn't cover today, things that you need to see? Is there concepts or proposals you want us to put together, what would the stakeholder group like to see happen at the next meeting?
So other than Bob's request for some other states' information, that's kind of, right now, I think that's the only thing that anyone asked for. And our job is to provide information and gather information as we can. And, we all go forward with our decision-making process. So if anybody's got ideas that they want to share now, go ahead. Otherwise, shoot a message to Dave or somebody at the program, and we can work on putting together whatever information you guys are looking for to help all of us understand the challenges and what we might decide for solutions.
I think from my perspective, it's certainly well worth the primacy fee. It's a great value for us. So I handle the questions when people call and want to know what they're paying on their $1.32, and it's certainly easy for me to justify that. I like the idea of increasing the primacy fee, but I guess what I'd like to see is maybe some proposals of how you would step that in or what you would suggest to do. I'm personally, probably shouldn't say this, but I'm all for increasing it because I really like the lab services that we receive, the coordination that we receive. We're used to it. It's really convenient for us to be able to handle things that way. I wouldn't want to see huge changes and it's easy for us to pass that fee through to our customers once a year. We can justify it. It's $1.32 or whatever it is for us now. If it went to $5, we could still justify it. So I would like to see what you would consider, how you would consider maybe stepping that through, and I think it's easily justifiable, but that's my opinion.
So we could definitely put together some concepts of, we can go to the calculator now and plug in numbers and look at that so you can kind of see what the generation rate would be. I think if we were looking at a fee where we wanted the primacy fee to cover all of the cost of this, you're probably looking at either across the board for all water systems fee of something in the neighborhood of like $6.25. That would cover all of that cost. If you're looking at a tiered approach, it's probably going to be something where on the high end it's going to be, like in the $8.10 range and down to, I don't remember what the bottom number is, something probably around $4 if you went with a straight everybody pays a 150% increase type of approach. So we could definitely lay out some proposals like that if that helps at the next meeting to kind of show what that cost would look like so you can see it on the calculator, give you some examples of what those would look like. And we could do that for any of those fees that are out there for those 4 fees. We can come up with some concepts if that is what you guys want us to do. Or if you have ideas, that you want us to put together that you think it would be a great idea if you did this. We can try to go back, look at our data, figure out how to show that in a calculator so you can see it. So we're open for any of that kind of stuff.
At least the primacy fee seems to give you the biggest bang for the buck. I mean, the other fees, yeah, we could go up a little bit, but it's not going to generate that much revenue really. So, and it's easy for us to pass it through to the customer, and instead of paying it on the back end if it was like a lab inspection fee, we could pay that too. But it seems like it would just kind of give you you'd know then what your projected revenue would be.
I'll ask the question just to see, kind of gauge some interest in this. What do folks think about the primacy fee? We got the tiered structure now. If we compress that and had a flat rate for everyone, is that a concept that people are behind so that we don't have to raise the fee as much on the smallest systems? Or, is it a better approach to look at a proportional increase, of that fee? Because those are 2 different concepts, and just kind of curious what people's thoughts are on that.
Well, my thought would be is that each connection is the same. Because, you know, it would be a big, if it was kept in the same way. So that would just be my, and I don't know if it's true that a larger system doesn't cost as much per connection as a smaller system? I mean, as far as what the services are. Now, if that is a true statement, then maybe there should be a breakdown between 1 to how many other thousands, you know, 10,000 or 20,000 and then 20,000 and up. But the smaller ones are definitely paying more.
Yeah, as a group, because there's more of them, they're,
Right.
you know, they contribute more because there's more.
But if you can show that that is true, that it does cost more because there are more systems, there's 1,100 systems versus 8 or whatever in the larger group, then that would make sense. But if we're just assuming that's how it is.
One of the things that we are obligated to do under our primacy is to inspect every system every 3 years, and while it would take a little bit more time to inspect the largest of the largest system, the difference in time and effort isn't all that different from a small system to a medium-sized system to a large system when it comes to that one piece. And there's other examples like that related to monitoring, et cetera. You know, if we're sampling one well, or we're sampling, you know, the intake or the, you know, the pipeline coming out of one of Kansas City's biggest plants, you know, the cost of that is the same. So, yeah.
David, I think I'm old enough to remember when we did the primacy fees, kind of. That says a lot about how old I am. But I think part of the discussion when that tiered structure was set up between the large systems and the small systems, like Chris said, those types of activities you described were probably more expensive for the bigger systems than the smaller systems. But use of the lab, the larger systems do not use the state health lab. Like, and correct, you guys from Kansas City, St. Louis, correct me if I'm wrong. They do not use the state health lab as much as the small system does. So it was felt that that was kind of the compromise, is that because the state is mandated by statute to provide laboratory services, and the smaller systems use that, the very, very large systems don't so much, especially on the back T sampling. So therefore, they're not using that service. So they shouldn't, you know, that was the compromise. They wouldn't pay as big a fee per customer as the small systems did. And the handholding. So that was some of the negotiations that happened back in the day. Boy, I sound old, don't I?
Yeah, but that context is really important. You know, it's really important to remember why those things took place. I guess back to Dave's question, though, because something Dave and I have talked about, the consolidated approach versus the tiered approach. And it's something we really need to hear from stakeholders on, is like, what do you want to see? Maybe you want to see the numbers in both approaches, but you know, the numbers Dave threw out there are, you know, he's just not guessing. We kind of know what it would look like with that shortfall. If we can all agree that that's the shortfall, that's kind of what the numbers would look like as it relates to per connection fee.
But yeah, I think, I wasn't in on the detailed discussions, but I would assume that when you look at, like you said, the services rendered from the fee paid, when you look at all the different things, that's how they kind of equalized the big versus the small systems when they set those fees. So.
Yeah, I mean, that's what I was kind of talking with Dave about earlier. It's like, you know, cost of service model, but I don't know if you guys really track the number of man hours you spend, right, on different activities for different size systems. That's the only way you could really build a true cost of service model. So, I mean, that's the challenge, I think, with what we're talking about, you know, small, medium, large type things, activities, right?
Right. We don't code time based upon system size or whether it's transient, that sort of stuff. You know, if you're a clean water stakeholder as well as a drinking water stakeholder, you're going to come to that meeting in a couple, 3 weeks and you're going to see numbers that are split out by sectors because that's how we code time over there. We do code time based upon sector over there. And so it's just not something we've done before, but I can say that there are instances like by inspection or, where you have these activity focused events that you're obligated to do, and you have to do all of them, all 2,700 of them in 3 years. We do know how long that sort of stuff takes. We do know how much every sample takes, and we know when there's multiple wells, it costs more money. When there's multiple locations to sample, it costs more money. And that well thing, we do see a lot of small systems where they have multiple sources, and we're spending a different amount or a larger amount of money in terms of what it costs to do those analysis versus the big system that just has one well or pulling from the river or whatever. But I wish we had the data. I really do. We don't have it for this discussion, but it could be a change that we implement moving forward to get it in place. So.
Why don't the large ones use the lab? I'm just curious.
We own our own.
We are.
We actually do laboratory sampling or analysis for other communities too.
So does this, are we the certifying on your laboratory? Do we certify your lab? So we do have some large facilities that send in water samples. I don't want to name them, but they send in 20 a week. But at the same time, if they're not sending us water samples, currently we do not charge for laboratory assessment for going in for bacteriological. So they're either getting samples to us or they're not being charged for the bacteriological services to go in and do an assessment at this time.
The trade-out though would be a 3-year inspection once every 3 years versus sending 20 samples a week.
That is correct.
Yeah, it'd be, the trade-off is much more we run our own, we're certified by the state, but we're running 100 a month and we run them ourselves because we're certified. So that would be 100 a month that the state lab doesn't have to run. So I could see those as point to that, but I don't know from our perspective if it matters that much, if it's all the same, or it's not that much money. I mean, on a general.
Yeah, I was just, for historical
Yeah.
perspective, just to, from what I recall, why the structure was set up the way it was. Now, why it was, $3.24 versus $1.08. I don't know how the calculation came about.
That makes sense.
But that was some of the reasoning behind the tiered structure.
And this is from a Missouri State Public Health Lab perspective. Currently, we don't have a fee for doing that assessment. We do have some labs that are certified, and they're not actually doing regulatory samples. Like local public health agencies, they're not actually doing public or certified public waters. And the reason they get certified because it's free. And so they can hang a certificate pretty much on the wall. And so to me, that's someplace that, I don't care about the fee as much as it may be a deterrent from people or from entities wanting that certification when they really don't need it. They mostly only do private drinking waters. So, but we have to offer that service. So.
To add to what Leon's saying, when we had EPA come down last November and they did our program review of our lab certification program, one of the concerns they raised was with Department of Health was that they only have a couple of FTE who are out there certifying 60 labs. And so one of the ways that we could assist with that would it be if there was a lab certification fee, because then ones like Leon's talking about that don't really need the certification probably wouldn't be applying for it, and then they wouldn't have to spend their time out doing, reviews of those laboratories. So that was one of the things that EPA brought up, but that's not necessarily mean that we need to add a fee. I'm just throwing that out for informational purposes. That was one of their concerns. So we're getting pretty close to 3, which I assume most people are going to want to be getting out of here because I know a lot of you came from Kansas City, Independence, and Springfield, and you got long drives to head back home. I just want to make sure that we got to have a good feel for what you would expect at our next meeting. And from what I have on my notes is you would like to see some discussion of what other states are doing as best we can, kind of maybe try to find some information. What other states are charging for certain services. We can try to do that. Maybe look at more of the 8 states next to us and try to figure out what maybe they're doing as far as fee structure in those states. And then I'm hearing that you'd like us to put together at least some proposals to look at next time so you can see kind of what a fee increase would look like on the primacy fee. Maybe look at all of those fees and come up with some concepts that we can bring back. So I see a lot of people shaking their heads, so that sounds like what you would like us to see or do for the next meeting.
The only other thing, to get at Eric's questions earlier about the projections as it relates to the out years and having a bit more of a realistic estimate of usage of the SRF as it relates to admin fee generation and re-show that chart. Really want to understand whether stakeholders agree with our solvency information. So do you agree that it's, a $7 million shortfall over the next 5 years? Because that's part of the formula that we're looking for. Do you agree with the shortfall? And then we move into, do you agree with whatever proposal we come up with to address that? Now, obviously, I think we'll look at where we're able to generate enough admin fees in the Safe Drinking Water Administration Fund to pay the state match. Maybe it's a year earlier or what have you, but it doesn't really change the outlook all that much, but we'll put it all together. Are there any big disagreements about the solvency information and the shortfall right now outside of just wanting to see that admin fee a little differently? Okay.
So I talked about this a little bit at the beginning. We're kind of on a schedule where we're trying to get the rule through by the end of the year. For us to accomplish that, we're going to have to wrap up the stakeholder meetings here in April. So we tentatively have these dates set as the dates for future meetings. So at this time, we're going to be looking at February 20th. It's the time for the next meeting. I don't know if you have a feel for how long you would like to meet. We have the rooms booked for the whole day, similar to like we did today, but I don't know if we'll need that much time at the next meeting because we probably won't have a huge presentation. It's going to take 2 hours of our time, and we're going to get into having conversations. We'll be able to show you the proposals and that kind of thing, but do you want us to schedule that for more like a 2-hour meeting from like 10 to noon, or do you want us to keep it open to have some afternoon discussion on that? What's your feel for how long you would like to talk at the next meeting about this? I mean, we can leave it open for a longer meeting, and if we decide that we're done at noon, we can break at noon. So we'll plan on having some afternoon discussion. I think it's always good to kind of have the discussion, give you guys a break so that you can go think about it, or if you need to talk to other people, you can do that. And we can come back to the afternoon session and have some more conversation. So we'll try to do that for the next meeting. So we'll be looking at February 20th, and that meeting will be held at our Lewis and Clark office building, so we'll be back in our building over there. And these other dates are on the calendar, and they're there if we need them. If we don't need to have those meetings and we come to a decision sooner on what we'd like to take forward, obviously if we do that at the next meeting and everybody feels comfortable with a concept, we can move forward from there. If not, we'll have another meeting on the 17th, and we'll pick up the discussion there with what other additional information folks need. So with that, I think we're done for today. And just again, thank you guys for coming in. We appreciate it. This is an important issue for us. I hope it's important for you that we provide these services. So thanks for your time.
Thanks, everybody.
Dave, is there any specific instructions provided
If there's anything that you want to send me, just email me. We'll be fine. And, or give me a call, whatever works the best, and we can talk.